Hello and welcome to the EcoCast by Actual Tech Media. Today's topic is transforming IT in healthcare environments. On this event, you'll learn from our experts at Progress, Rubrik, Synology, Faction, Duo, and Nasuni. Thanks so much for joining us on the EcoCast today. If you're a technology professional in a healthcare environment, this event is for you. After all, digitization is coming to healthcare just like the rest of the world. But in healthcare environments, the transformation requires a special set of skills, let's say. Our expert presenters on the EcoCast today will be tailoring their presentations to your unique challenges. Now, before we get started, there's just a few things that you should know about today's event. We always have some awesome prizes on the EcoCast. I'll be talking about those here in just a moment. But first, I want to make sure that I take a moment to encourage your questions. We've got a lot of folks out there saying hello and greetings, and we welcome that from across the United States and around the world. But we also want your technical questions, and we even have a best question prize, one for each Q&A session on the event today to help further those questions. I'll also have some poll questions for you out there in the audience during the event. We also encourage you to socialize this event. You can do that over on Twitter using the Twitter icon right there in your audience console, and the hashtag for today will be automatically appended. I also want to call your attention there to the Handouts tab. It's there that you can download some hand-selected resources from today's expert presenters. I'm talking about special trial links, evaluations, ebooks, solution briefs, and more. The prize lineup on the EcoCast today is 3 Amazon $500 gift cards. Of course, you must be live in attendance to qualify for the prize drawings and meet the Actual Tech Media prize terms and conditions that you can find right there in your Handouts tab. We will be announcing those prize winners verbally during the event. And then, as I mentioned, we also have our best question prizes, which are Amazon $50 gift cards, one for each of the sessions on the event today. Not just one Amazon $50 gift card, but one Amazon $50 gift card for each session on the event. So make sure that you keep that in mind. Prize winners will be selected and contacted after the event. And of course, all prize winners must meet the Actual Tech Media prize terms and conditions. All grand prize winners must submit an IRS Form W-9. We do reach out to prize winners via email after the event. And you always have an option to make a donation to the selected charities you see here on the screen. Over the years, we've donated thousands of dollars to charity, and we would love to help you do that if you win a prize. The hashtag for today over on Twitter is ATMEcoCast. I'll be following and commenting and retweeting just about anyone out there talking about the event. You can also follow Actual Tech Media and me, your moderator, David M. Davis, over on Twitter. I'll be joined by fellow moderator from Actual Tech Media, Scott Becker, later in the event. I encourage you to follow Actual Tech Media on LinkedIn. You can do that right there from your audience console. And also check us out over on YouTube. That's where we post recordings of all of our events. I also want to encourage you to check out the gorilla.guide website. You can find a link to that right there in the Handouts tab of your audience console. This is a great place to download free, easy to read enterprise IT books authored by top industry experts. It's a great way to stay up to date on enterprise technology. Yes, they do work on your iPad, Kindle, or mobile device. And did I mention they're all free? That's right, full-length educational IT books over at gorilla.guide. All right, so with that housekeeping information out of the way, it's time now to bring in today's keynote presenter. Welcome to Brian Posey. He's a 20-time Microsoft MVP, technology columnist, speaker, and analyst. I'm sure you've read his blog posts and read his many books across a wide variety of technology subjects. Brian has a background in healthcare IT specifically, so it's great to have him on the event. Brian, take it away.
Hi, I'm Brian Posey, a 20-time Microsoft MVP and commercial astronaut candidate. And earlier in my career, I worked as a CIO in the healthcare industry. So today, I want to take a moment and talk about what I consider to be the top 5 issues in healthcare IT. The first issue on my list is HIPAA compliance. Now, I've got to be straight with you. I seriously thought about not including HIPAA compliance on the list just because it's one of those things that we're all so very well familiar with. I mean, if you really stop and think about it, HIPAA compliance has been a thing since 1996. That's 25 years. So HIPAA compliance is one of those things that IT professionals working in the healthcare sector have had to deal with seemingly forever. But that doesn't diminish the importance of complying with HIPAA. And today's world is rapidly changing. The world today barely even resembles the world of only 2 years ago. So we have to think about HIPAA compliance in a new way and rise to the challenges of addressing HIPAA compliance and maintaining our compliance with the HIPAA regulations in this rapidly changing world that we live in. Another issue that's super important to consider from the perspective of healthcare IT is ransomware. Now, ransomware is another one of those things that's been around seemingly forever, but there are a few things that you have to think about with regard to ransomware infections. The first thing is continuity of business. A ransomware infection, even if it ultimately doesn't do any significant damage, can be disruptive because you're put in a position where you have to spend time undoing the damage. Now, when we start talking about ransomware from the perspective of healthcare IT, then we also have to start thinking about data breaches. Because if a healthcare organization suffers a ransomware infection and there's any chance that protected health information was leaked as a result of that infection, then there might be disclosures that have to take place as a result of that. This brings me to another point. Ransomware has steadily evolved over the years. Early on, ransomware was simply designed to encrypt the contents of a local hard disk. Eventually, however, ransomware became more capable. It started doing things like encrypting data residing on network shares and even in some SaaS applications. Some ransomware even goes so far as to target backups so as to limit an organization's ability to recover from a ransomware attack. But from a healthcare perspective, perhaps the one aspect of modern ransomware that's more troubling than anything else is that a lot of ransomware infections are no longer content to simply encrypt data. They also threaten to disclose that data to the public if a ransom is not paid. So consider this from a healthcare perspective where there are penalties associated with data breaches. If you've got a ransomware gang who is threatening to release your electronic protected health information to the world, then you've got a very serious problem. So this is certainly something that has to be considered from a healthcare perspective. Another issue that's hugely important from a healthcare IT perspective is the current work from home situation. Now, a lot of people looking in from the outside assume that healthcare workers are frontline workers who have consistently come into the office throughout the entire pandemic. And when we're talking about the actual practitioners, that's largely true. But in a clinical setting, there are often people working behind the scenes who aren't doing hands-on work with patients. I'm talking about people in roles such as medical billing. And those people very often are working from home. So you have to consider how to give those people the access that they need to the data that they need to work with, but to do so in a way that continues to comply with all of the various HIPAA regulations. Because you never want to be put into a situation in which data is being stored improperly in a way that violates the HIPAA regulations. Remember, the pandemic doesn't do away with HIPAA regulations. Those same regulations that we've always had to deal with are still in effect. So you have to be very, very careful about how remote workers are accessing sensitive data. Another major issue for employees working in healthcare IT is telemedicine. Now, telemedicine is another one of those things that's been around for quite some time, but it really ramped up at the onset of the pandemic because telemedicine made it possible for doctors to see patients without those patients actually having to come into the office. So telemedicine certainly has its place. What we need to be thinking about right now, though, is telemedicine security and how the doctors are actually interfacing with patients. In other words, what device are those doctors using? Are they working from a personal device that is configured in an unsecure manner? Does the device comply with HIPAA regulations? Are telemedicine sessions being recorded? There are any number of things that you have to consider with regard to telemedicine. For example, if those telemedicine sessions are being recorded, are they being transcribed and added to electronic protected health records? So we have to consider not just how telemedicine sessions are being conducted today, but also what those telemedicine sessions might look like in the future as we go forward. Another major consideration that needs to be taken into account by healthcare IT professionals is that of data silos. This is another one of those issues that's existed forever, but it's starting to become a little bit more pronounced. The basic idea is that in any clinical setting, there's probably vast amounts of data being generated, but very often that data is siloed. And the reason why this is a problem is because it makes it tough to pull all of that data together to form a single source of the truth. Think about the last time that you visited a doctor. When you checked in for your appointment, you were probably asked to complete a form. And that form probably asked a number of questions, not just about the issue that you were there for, but also about your past medical history. So if you really stop and think about this from an IT perspective, what that means is that patients are being asked to populate their own data as opposed to just being able to pull up past data from a variety of different sources and already have that patient's medical history on hand. So from an IT perspective, we need to think about the issues that data silos cause and how we can work around those issues, but without violating patient privacy laws in the process. So just to quickly recap, my top 5 issues were HIPAA compliance, ransomware protection, work from home, telemedicine, and data silos. I'm Brian Posey. Thanks for listening.
All right, great presentation, great advice, Brian. We do appreciate that. And I've just brought up our first poll question of today's EcoCast, and I created this right around Brian's top 5 challenges in healthcare IT because I want to see if what he identified as the top 5 challenges line up with your top 5 challenges out there in the real world of healthcare IT. So it's the same list, the same 5 challenges: HIPAA, compliance, ransomware, prevention and recovery, work from home, remote or edge locations, telemedicine challenges, and data silos. But I added a 6th one on there. If there's a challenge that's not listed that you're experiencing in your healthcare IT organization, drop it in the questions pane because I will share it with everyone out there. I'm not going to share your name, but I will share your challenge, and that way you can see how you stack up with your peers, and I can help to identify additional challenges to add to this poll next time. So I'll let everyone respond to the poll there on the screen. You just do it in the slides window. If you don't see the poll, push refresh on your web browser, and 99% of the time that will resolve it. I see lots of great responses coming in. 2 of you so far have said that you have other challenges not listed. Again, just drop those in the questions box. All right, thank you to everyone who responded to the poll. We do appreciate that. Let me go ahead and share the results now. And it looks like 53% said ransomware prevention and recovery. That was the leader, followed by work from home, remote location or edge location challenges, followed then by HIPAA compliance. So thank you everyone who responded there to the poll. And then last poll before I introduce you to our first presenter, and that is, what's your time frame for taking some action to add new or update your existing IT solutions at your company, specifically, around the types of solutions we're talking about today: managed file transfer, data protection, ransomware recovery, storage, resolving those kind of data silo challenges, leveraging cloud, improving security, and more. All right, I see lots of responses coming in. Thank you for those. Let's get just a few more. We've got our first presenter here waiting in the green room, ready to go. All right, excellent. Thank you to everyone who responded there to the poll. We do appreciate that feedback. All right, and with that, it's now time to bring in our first presenter on today's EcoCast. Welcome to Tony Perry, Principal Solutions Engineer at Progress. Hey, Tony, thanks for being on.
Hey, thank you. Glad to be here.
Excellent. Well, take it away.
All right, sounds good. Yes, so welcome everyone. Once again, my name is Tony Perry. I'm a Principal Solutions Engineer with Progress, specifically focused on our Move It managed file transfer solution. So we're going to spend about the next 20 minutes or so talking a little bit about MFT, especially as it applies to healthcare, which almost entirely revolves around HIPAA protected data. And so we'll do a few slides and a little bit of a demonstration for you as well, and wrap up with some Q&A. So probably preaching to the choir here, but it goes with, it's worth repeating that protecting PHI data is critical. It's always been important, but especially within the last several years, the fines have certainly increased with regards to any sort of breaches or just any sort of exposure of HIPAA controlled data. So just really huge concern for anyone in healthcare, whether it's on the provider side or on the payer side. Just very, very critical being able to protect that that health information. And especially as it pertains to MOVEit, it's why is that data so vulnerable when it's being transferred? And so, one thing is oftentimes you're exchanging data with other third parties, whether it's insurance companies or other healthcare providers, or maybe it's a new SaaS solution that your organization is utilizing for analytics, and you have to transfer large chunks of data to them for them to analyze. A lot of times it's fire and forget it. Like the data leaves your organization, and then it's not your data anymore. It's somebody else's. So it's in their concern, and a lot of times that data just gets transferred unencrypted. It's get this project done as quick as possible and move on to the next thing. But that data that you might be transferring to your insurance plan, or to that new SaaS analytics solution that you're leveraging, it really can contain a lot of sensitive data. And putting it in flat files makes it extremely easy to parse, right? That's why you put it into flat files in the first place, is because that is sort of the lowest common denominator and easiest way to transfer that information to other partners and for ingestion into other systems. But really a lot of due care is required with transferring those files because of the ease of which that sensitive data can be pulled out of those files. And so kind of alluded to this a little bit, but I still remember going into the doctor and they would pull your chart out of the filing cabinet, right? So as long as your particular doctor's office did not get broken into, and even if it did, probably wasn't a whole lot of value in getting at somebody's medical charts back then. But nowadays, the healthcare has really evolved, and like everything, it's you're connected to all these other systems, and all of your records are electronic, and then those need to be transmitted to other providers or to the clearinghouse for so that you can get paid and such. So it's really just evolved to where that protected health information is no longer just sitting in a filing cabinet somewhere, but it needs to be exchanged with all these external parties. So that really leads us into why choosing an MFT solution. So if you're not familiar, MFT, the acronym stands for Managed File Transfer. Really, it's a class of software that is, well, obviously for transferring files, but really to address the needs of industries like healthcare and financial services, where a lot of their critical business processes are dependent, believe it or not, on transferring files. And those industries are heavily regulated and also dealing in sensitive data. So just some of the reasons why you might choose an MFT as opposed to just putting together something homegrown or something free or low cost, is that MFT is purpose-built for security, right? I mean, that's a big driver behind MFT, is being able to securely exchange that data, being able to administer everything in one place versus having all these different silos all over where different scripts and credentials and secrets and whatnot are stored maybe in plain text on workstation somewhere. Auditing and logging, very, very important for demonstrating HIPAA compliance when the auditor comes around. And then also just additional capabilities like, being able to use MFA or tie into single sign-on or leverage REST APIs. I mean, these are all features and capabilities that are part of a MFT or managed file transfer solution. So as I mentioned at the onset, I'm with Progress, and specifically on the Progress MOVEit MFT solution. And so really, if you go out to our website and look around and stuff, you might see some references to different components and different products. And, really MOVEit is all built around, the secure and secure exchange of sensitive data. And so some of the different components are MOVEit Cloud, MOVEit Transfer, MOVEit Automation. I'll be showing you a demonstration of some of these here today. MOVEit Cloud is a SaaS offering. So if you're looking at what MOVEit can provide, but saying, we don't really want to deploy this software on our own, we just, we have a cloud-first strategy, or if possible, we like cloud solutions, MOVEit is available as a SaaS offering. If you like the more traditional, we want to stand up the software ourselves or even deploy it in our own Azure, AWS, infrastructure as a service environments, we have MOVEit Transfer and MOVEit Automation, which are the two main components of the MOVEit MFT solution. And so this just kind of, is another visual of where MOVEit would sit. Like I said, it could be in your own data center, it could be in Azure, it could be our SaaS offering, but, really high level conceptually it's designed to sit between, your internal back-end systems, like shown on the left, and your external third parties systems shown on the right. And so at its heart, MOVEit is really data agnostic. It doesn't really care what the data is that you're transferring it, whether it's health records or claim files or enrollment files. I mean, I'm sure those that type of data resonates with some of you on the call. And regardless, MOVEit will move it or transfer it in a secure, encrypted fashion with tamper-evident audit trail, high visibility into those transfers, and be able to do it in a secure and compliant fashion. All right, so with that, now we're going to switch over to a live demonstration. So let me make sure I can share out my screen here. All right, so you should be seeing my browser out here, and we have our fictional, just want to make that clear, this is a fictional Mercy General Hospital, but just kind of using it as an example for our demonstration today. And so I'll get into our MOVEit Transfer and or MOVEit Cloud. So everything you see here, this functionality, this experience, these use cases, these can be accomplished using MOVEit, both MOVEit Transfer on-prem that you deploy yourself, or by subscribing to our MOVEit Cloud SaaS offering. And so really, this aspect of MOVEit is all about the secure upload and download of data. Really typically to be able to facilitate the exchange of that data with external partners, vendors, suppliers, etc. So if we take a look here under users, you can see that our administrator has set up some different users. So this could be clients. You might have external clients that you need to exchange files with, or partners, or you have internal users that might need to be able to log on somewhere and maybe share a file out with some external party on more of a one-off or ad hoc basis. And if we just, we're not going to get too into the weeds here today, but just to give you a sense for some of the security and controls that are available, like when you're setting up an account for an external partner, let's say, they can have an email address so they can get email notifications. Under the authentication section, accounts can have expiration policies, multi-factor authentication may be required or is optional if somebody wants to enable it. IP addresses can be restricted. So really a lot of the security controls that are necessary when you're, transferring PHI or even PII is being able to, apply that level of security and control. And then typically in MoveIt, the way it's set up is that a particular user is going to be very least privileged. So like here, they might only have their own individual downloads and uploads folder where they'll be able to log on to and upload or download files. So if we, sign out there and instead sign on as, say, one of those external partners, this would be the web interface that an external user might leverage to log on. If you today have like an SFTP server or something in place that you're currently using for exchanging files, MoveIt also supports SFTP. So external parties that want to automate their transfers or who just have an established workflow and want to continue to leverage that certainly can. But where having the web interface comes in handy is for like those mom and pop partners that it's someone's job to log on and transfer files. So they can log on here. You can see, okay, there's some files available out here to download. The user could easily, click on that to download a file. If they, refresh, that file is gone. It's not totally gone, but it's no longer considered new. So like if that user went into their own home folder and went to that downloads folder, here they would see the file's still out there, but only these two are new. Same thing for uploading. Very easy for a user to log on, and if they have, whatever, we talked about some of the different types of files they might have. Doesn't really matter to MoveIt. So whatever files it is that they need to upload, they could select those, maybe type in some notes if desired, and they can go ahead and upload those files. So they were basically uploaded encrypted. They're now stored encrypted by MoveIt, so encryption in transit, encryption at rest, and there is the integrity verification. Also, there's a tamper-evident audit trail. We touched on that earlier, but if we, go back to our admin console here, some things that the administrator can take advantage of is the live view dashboard to be monitoring transfers that are, currently happening or ones that have recently completed. Clicking on the status for any of those really brings up that detailed audit log record of that transfer. This is also available longer term under the log section. So there's all different sorts of ways to go in and query and filter these logs. A lot of times the question is, okay, this external party says they never downloaded the files or they never uploaded the files. So you can go in here and apply your filters and have that, audit trail showing, yes, indeed, they did download it, what IP address they came from, so on and so forth. So that's, kind of high level of the Move It transfer or Move It Cloud component. The other main component that is part of Move It is Move It Automation. And this one comes up a lot in healthcare, especially maybe smaller practices and such, where they might be leveraging a cloud-based EHR system that is generating flat files like claim files, 837 files, I think they are, and yet it's up to the healthcare organization then to pick up those files and deliver them and transfer them somewhere else. And that's really what Move It Automation is all about automating the movement of files between different disparate systems. They can be all sorts of different file transfer systems like network shares or SFTP servers, even SharePoint or Azure Blobs or Amazon S3 buckets. So with Move It Automation, the administrator is able to set up those connections, and then the way the transfers themselves are automated are by creating tasks. And so an example of a task like this one is, really you're defining this in a designer first capacity where you're just, through point and click specifying, okay, these are, this is the server and these are the files that this task needs to go out and pick up. And then when it does pick up files, here we're saying we want them saved on these different network shares and renaming them. And then Move It Automation has a built-in scheduler as well. So rather than, if you're doing any of this today, you might be leveraging scripts or Windows Task Scheduler or cron, and you have multiple places to try to figure out whether or not something works successfully. So with Move It, you can just put your schedule right in here attached to that task, and also notifications. So you can get nice, HTML, nice friendly notifications, like when a task runs and succeeds or runs into an error. So you might have tens or hundreds, or we have customers that have even thousands of these different tasks defined out here. And then, very similar to like what you saw over on Move It Transfer / Move It Cloud, is that in Move It Automation, everything is audited and logged. So in Move It Automation, we're keeping track of tasks that run. And, for example, I could drill down now into this task, and this is going to give me a real, granular detail about every file that was transferred by this task, all the way down to the details of where that file came from and where that file was transferred to. So this, once again, really helps to answer those questions about, hey, where did my files go? And then it looks like I probably have like about a minute and a half, so I'm just going to show you one more use case here that comes up a lot, especially in healthcare for Move It, and that is Adhoc Transfer. And the scenario here is more of a, let's say, person-to-person transfer, where you might have a document that contains PHI, and you need to send that file somehow. You could have secure email in place, but the file might be too big if it's over 10 meg, and that's your limitation. So Move It Transfer or Move It Cloud can also provide a nice user experience for sending one-off ad hoc transfers. And so this is just providing a very email-like user experience for the end user. So this would be like an internal user who just would go to the site or even do this right from within their Outlook client. But I'm really just specifying, who the recipient is and clicking on send. Basically what's going to happen is everything is going to get parked out on the Move It Transfer server. And then, our external guest recipient is going to get an email notification that they can use to come in and download and access those attachments. But all right, so I'm going to go ahead and stop sharing, and let me get back to here. And awesome. So yeah, I think now we're going to do some Q&A.
Absolutely, yeah. Great presentation, really cool. Well, thank you so much, Tony, for the time to show us that. We do have questions for you from the audience, and while we take those questions, I'm just going to bring up this poll for everyone out there that says, what additional information would you like about the Progress Software solution? So we want to get your feedback here on this poll. Let's see, first question I wanted to ask you, Tony, there's a lot of good questions. I'll start with this one here.
Okay.
They're asking what size organization could benefit from file transfers in the cloud? Does this help specifically small organizations or very large, or just kind of across the board?
Yeah, it really is. It really is across the board. So I mean, like I touched on earlier, it might even be very, small practices, maybe one office or something. But if they are using cloud for everything, their EHR is cloud-based and stuff, then they could certainly benefit, especially from a cloud-based MFT solution. If they don't have the IT staff and whatnot to maintain an on-prem solution. But even larger organizations that have a cloud-first strategy could really benefit from getting the functionality and the security and compliance that MOVEit can bring, but being able to get that in a SaaS offering versus the traditional on-prem approach.
Absolutely, yeah. It's great that it has that wide of applicability. Another question here, they're asking about billing SLAs. Can this help me to meet billing SLAs, they said?
It can, yeah. I mean, anytime you're talking about service level agreements, especially where there could be fines involved if you miss an SLA and stuff. I mean, that really gets to the tamper evident audit trail that I was showing in the demonstration and touched on in the slides, because if there's a disagreement, let's say, and one side thinks an SLA was missed and the other side thinks it wasn't, being able to have those audit trails showing, no, we met that agreement, we pushed those files to you at such and such a time, and this is how large they were, and this is where it came from and stuff. Definitely, having that audit trail, that record of all those file transfers, especially can come into play there.
Nice. And then there's a question here from Bill, who's kind of asking about the architecture of this. How does that work? Is this something that runs in the cloud? Is this on premises?
Sure. Yes. Yeah. Yes. All of the above. So I kind of touched on it earlier, but the MOVEit Transfer / MOVEit Cloud component, the first part that I demonstrated, that piece, that component is available for deployment, on-prem in your own physical data center, or you could deploy it in Azure or AWS or any other infrastructure as a service, virtual private cloud provider you choose. That is also available as a SaaS offering. So if you literally just want to, subscribe and get your credentials and be able to log on and immediately start setting up users and folders and permissions and stuff, that's certainly the fastest way to get going with it.
Nice. And then is there a evaluation or free trial of this?
There is, yes, yeah. So I mean, if you're interested in evaluating, I believe there will be some action links to contact us, but can talk to one of our MOVEit account managers, and if evaluation is your preferred choice for evaluating new solutions, they can set you up with a 30-day evaluation. Same thing with MOVEit Cloud. So if you're primarily interested in the cloud offering and you want to take that for a spin, you can sign up for a free use trial as well.
Excellent. And I like that you all have these QR codes. I'll bring up these QR codes for anybody out there who wants to grab your mobile phone and scan the QR code there and get access to a on-demand demo or contact the Progress team. It seems like a easy and fun way to do it right there. So Tony, it's been great having you on the EcoCast today. Excellent demo again. Thank you so much.
All right, thank you.
And thank you to the Progress team for joining us on the event today. Also want to call your attention to the handouts tab there where you can download a solution brief from Progress specifically on Move It for healthcare. So make sure that you check that one out. All right, hopefully you had time to scan the QR code there because we are moving on now to our next presenter on today's EcoCast. Welcome to Alan Hall, Sales Engineer at Rubrik. Hey, Alan, thanks for being on.
Hey, good morning, good afternoon, depending on where you are. Nice to speak with everyone. Thank you for having me.
Great to have you. Take it away.
Awesome. Thanks. So just quick background, sales engineer here at Rubrik. I've been with Rubrik for going on 3 years. Prior to that, I spent about a decade in the MSP service provider space. I was one of Rubrik's first customers in the New York area, which is where I'm from. And loved the technology enough to take the jump and try my hand at helping other customers with Rubrik. So I'm happy to speak with everyone today. I do focus on the healthcare vertical in the New York, New Jersey area, but I'm happy to help anyone with any questions around Rubrik. So what is Rubrik, right? When we talk about data security and data protection, that's really the core of what Rubrik does and offers, right? Now, especially in today's landscape with cyber threats, having confidence in your data protection solution and the ability to recover is critical, right? And when you've got that inevitable sort of attack, you've got to know that you can get up and running quickly and know that you've got a clean state to go back to. So, for healthcare specifically, when we look at a lot of challenges that the organizations are facing with, right, the number one by far, right, is ensuring that they can recover from a cyber attack, right? Again, we're a data protection platform. We're not going to say we prevent anything. That's what your frontline tools are for, but we're a last line of defense, right? And if something does get through those walls, it does attack your production infrastructure, and it probably will go after your backup infrastructure. You want confidence that you still will have that backup infrastructure in place to be able to restore from. But, second to that, right, are the ideas of simplicity, scale, and obviously performance, right? You want to make sure that whatever solution you have in place or you're replacing with your existing solution is easier to use and manage and scale and hopefully performs better as well. So we'll talk more about all three of these sort of problems in detail. What I wanted to walk through next was this idea of security, right? And what we're seeing with ransomware attacks today, it's really, we're seeing across Rubrik customer base, we're seeing attacks honestly on a daily basis across the 4,000 plus customers that we have. And so this is definitely a problem that needs to be addressed from a lot of different angles. But again, we want to make sure that if you do get that nasty ransom letter, that you're confident in being able to recover. But if we walk through this, right, you've got a couple of options. They're usually not great, right, in most circumstances. You can pay the ransom, which is never a good option. Low likelihood of even getting what you need out of that, right? I've seen where customers have paid the ransom, they get the tool to decrypt the data, and it's so slow that, it would almost have been better for them to recover from tape or, just try to surface those recoveries elsewhere. So they paid all that money and it didn't really get them back up, right? And to be honest with you, the cost of the ransom is one thing, but what surpasses that exponentially is the cost of the downtime itself, right? If you're not able to process, patient records, even billing, right, for hospital systems, that's where the cost really comes into play. So sometimes even paying the ransom is not even an option, and it doesn't really get you to that end state. Obviously for maybe you call this option 1 versus option 2, you pay the ransom as a last resort, but you're certainly going to attempt to recover the data if you can. And usually that's going to be the IT infrastructure teams that are doing that. And what we're seeing more recently is that, security teams are always involved in these actions, but again, the infrastructure team is the ones that own the data, and they're the ones responsible for bringing it back online. But, the questions become, okay, well, even if we have data to bring back, assuming that our backup infrastructure hasn't been completely compromised, or maybe it has and we're pulling it from tape, right, which again goes back to my point about, recovery time. How do you know, sort of what data has been affected, right? How do you know what you need to recover? So are you able to have some visibility on what that blast radius is and really understand what workloads have been compromised? The other thing that we see a lot with these ransomware attacks is double extortion attempts. So it's not just enough to encrypt your data. They're actually taking it outside of your data center, your 4 walls, and putting it on the black market, right? And so the idea of, can we identify what data in the environment is actually sensitive, so that we can have some sort of determination of, hey, if we get that ransom note, do we know that they got, to this sensitive data or not? And then another important aspect is, even if we can recover and we know that blast radius, how do we know that we're not going to reinfect bad data, right? We've seen a lot of attacks on average are the malware or that vulnerability is evident in the system for an average of 72 days. And so, it's very likely that your recovery point from yesterday can have that vulnerability in it. And so restoring that system, while it might have been right before it was encrypted, just means that there's a high likelihood that it'll just get reinfected again. And so that's obviously an important thing. And that's where, we see security and infrastructure teams coming together a lot, right? Because the infrastructure teams are providing the recovery of those backups, and then the security teams have to go in and do a bunch of manual tooling and scanning to try and figure out if those vulnerabilities exist in that data, or if it's clean and can be put back into production. And then, of course, how quickly or how long will it take to do all of this, right? Is it going to be a quick process? Do I have to pull things from DR or from tape or from another location? So that becomes really important with, the time to recover and getting the data back up available for the application owners or for the business to continue operating. So with that, right, Rubrik has really adopted this, we call it zero trust security model, right? And there's a number of components to this, right? I think the foundation of it is our, cloud data management software itself and the architecture that we've built, right? So a number of components to this. One is a built-in multi-factor authentication, and certainly we support all of the federated AD and Oktas and any sort of SAML-based provider for MFA. But it's what we see in a lot of attacks is those infrastructures, particularly Active Directory, are usually compromised. And so backup administrators are going in and using that sort of break glass local account that's on the backup system itself. And most of the time, that's just a single username and password that is stored in some sort of password vault, which again, we've seen attackers gain access to those. And so knowing that that's truly your last line of defense and probably the only way you'll be able to get in and do recoveries, we enforce MFA on that local account so that there's no way that you can get in without a multi-factor. Another important aspect is this idea of a logical air gap. So traditionally with backup infrastructure, you've got your backup software and systems writing to some sort of storage device, right? And typically that's over like an SMB or an NFS protocol. We made a strategic decision actually well before ransomware was really rampant for organizations of consolidating both the hardware and the software layers together, and we can't decouple them. It's designed as a holistic sort of hyper-converged solution. And so with that, the only way to access and put data on the appliance is through our API and remote procedure calls. There is no way to access the file system itself from outside, which gives us a logical air gap, right? And again, we're doing that on the first copy of data, so we're not relying on a DR site or some sort of physically air gap solution to give you that security. We give it to you in the first copy on the primary layer. Another important aspect to the file system is the fact that it's natively immutable. So we built our file system from the ground up. There is no sort of modify construct built in. You can only, write data, append data if there's new data written, and then read that data in the future. Now, immutability, though, is not enough on its own because that data can also be expired, right? And we'll talk about sort of SLAs and retention policies, but the idea of an administrator, whether it's rogue or whether an attacker that compromises credentials gets into your backup system, if they're able to get to those policies and set them to zero, the retention or remove objects from protection or whatever, there's a risk there. And so we've also implemented this native capability of retention lock, where we can actually turn that on a per policy basis. And once enabled, it's impossible even for administrators to remove that lock. It's a sort of a two-step, two-signature process that we require opening a ticket with our support team, engaging those two people, getting sign-off, and then removing that lock, to be able to make any sort of negatively impacting changes to those backup policies. And so that's how we prevent even, unintentional expiration or intentional expiration of backups before they're supposed to be. And the last piece of this, and one that often gets overlooked, is time, right? So NTP protection is something that, or I should say NTP poisoning rather, is something that gets often overlooked and where attackers have an easy time with this, right? If your backup solution is looking at an NTP server for time, even if you've got 7 or 10 year retention out there, if they roll that clock forward to 2050, all of a sudden your backups are now, the clock is saying, oh, my system says I need to expire this, and they all go for deletion. And so we're so zero trust that we don't even trust your time source, right? And we actually leverage what's called a monotonic clock, which basically just measures the passage of time from when that date, when that content is written. And because it's immutable, we can't modify those times of when the data was written. So we completely ignore NTP altogether, and we use the monotonic clock to make sure that we're not inadvertently expiring data. So with that foundation, there's a number of other things that we look at, right? So once we've kind of got this idea that you've got the confidence we can recover your data, there's those other problems that I mentioned before. So we have a ransomware investigation capability, which really does anomaly, but more importantly, encryption detection, right? So we're not just looking at anomalies, which often generate false positives and oftentimes get ignored by your teams. We're actually identifying encryption. So we're looking at the entropy, we're looking into the files themselves to determine if this PDF is still a PDF or not, right? And we're able to do that at scale, all on the backup infrastructure, so there's no agents or anything that you're installing in your production environment to give you that insight. And if there is an attack, we'll be able to see what data has been encrypted and give you an idea of the blast radius. So you know that it was these 10,000 files or these 30 servers that have actually been affected, right? You don't have to blindly go in and start restoring or overwriting good data because you don't know what's good and bad. And particularly on NAS infrastructure, where you might have a share with lots of different permissions and data sets, you don't want to overwrite, good data with an entire snapshot because you don't know what was good and bad. So we give you that really granular capability to make that determination. The other thing we can do is help you identify the sensitive data. So this has certainly a security and a ransomware recovery element to it, but it's also a great compliance tool, right? So if you're looking for GDPR, right? If you've got to make sure that you don't have any data, by a person's name, you would be able to search through the backup infrastructure to determine what's out there. Or if you're looking for PII information, or if you take credit cards and it's PCI, right? You can make sure that data is not in a user's, home directory or on a share where it shouldn't be. But certainly for the ransomware use case, it can also help us determine where sensitive data lives in your environment in general. And so we can determine, hey, if this data wasn't encrypted, it's very unlikely that they got to it in the first place, right? And it sort of helps with that double extortion story that we spoke about before. The other thing that we're offering is the ability to automate what security teams would traditionally have as a very manual process of, okay, hey, infrastructure team, give me these 50 systems from these 5 days of backup, and I'm going to go and install my tools on it in some sort of sandbox environment. Figure out if the vulnerabilities exist on them, and try to find a clean point in time, right? So we're giving you the ability to do that on the backup infrastructure using the appliances that we're already putting in place and storing that backup data on. There's no agents, there's nothing you have to install in production, and we're giving you the ability to automate that. So you can pick those 50 systems, you can pick those 5 points in time, and we'll go through and scan using YAR rules or any sort of context-based searching, which a lot of the security teams are very familiar with and standardize on today. And they can plug in their own YAR rules and do those searches and look for those threats and identify those clean points in time so that you're not, potentially reinfecting the environment with bad data. And last but not least, you've got to be able to recover this quickly, right? So we'll talk about some of the performance aspects, but the idea of being able to automate this, not only from a ransomware recovery standpoint, but also a disaster recovery standpoint. So we've got, a concept of blueprints where you're sort of specifying what your application stack looks like, boot orders, boot delays, pre and post, boot scripts, right, that can be executed upon recovery, re-IPs, et cetera. So we're giving you that ability to make all of that easier so that whether it's recovering from ransomware or a true sort of geographic disaster, you're able to get your applications back up quickly. And it's an automated process, right, that you're not having to sort of manually click around and figure all that out at the last minute. So combining all of these things, right, one unique thing that Rubrik offers is a ransomware recovery warranty. We're so confident in the technology that we've built and the capabilities that we have that we're willing to insure our customers up to $5 million, that if they get hit with ransomware and they're unable to recover with Rubrik, we pay up to $5 million. So it's a, kind of putting your money where your mouth is situation and really standing by, what we built. So we kind of covered the security aspect of this, but certainly the simplicity and performance are equally important. So architecturally, right, Rubrik is a clustered, hyper-converged system. All the nodes in the cluster participate in job scheduling and task management and the user interface and the API and all of those things. So as we scale nodes, we're scaling not only capacity, but also performance with it. We also have a combination of SSD and spinning disk, and now we even have an all-flash version for customers that feel like they need that. But to be honest, most of the hybrid appliances that we've had for the last 7 years have been sufficient. And there's really no limit to that scale. We've got, multi-petabyte clusters in production at many healthcare systems across the country today. So that's something that we very commonly do, but we always look at the requirements and determine what that architecture should look like. One of the unique things about Rubrik is this SLA sort of driven policy engine that we have. So we've taken traditional job management that you do with a lot of backup systems, right, where you've got a backup, a recovery task, you've got archival, you've got replication, you've got all these different jobs that have to execute, and if you're doing it across thousands of systems, it becomes really cumbersome to manage. And so with Rubrik, we're basically defining policies that say, how often do I want to protect, how long do I want to keep that data for, where do I want that data to live, and then we manage the life cycle of those objects that are under that SLA for the entirety of how long we're keeping that data for and where it goes, whether it's being archived to public cloud or another data center for long-term retention. We support all of those use cases, and we're managing it with a single policy. So most customers are going to a handful maybe a dozen or 15 policies for, what would traditionally be thousands of individual backup jobs. And Rubrik, what's really nice is we balance the load and automatically manage, the job and task management across the cluster. So you're defining when that sort of backup window can occur, and we're automating when all those jobs run and making sure that they don't step on one another or cause any sort of latency or performance issues in the environment. The other thing that's nice is our API-first design. So even our own user interface is built on our API, but it's certainly great for extensibility, whether that's things like ServiceNow, whether that's your SIM tools for the security teams where they want to plug in our logging for audits and syslog, et cetera. So there's a lot that we can do, but pretty much no limits to the API. Everything that you can do or you see in the UI, you can do in the API and more, to be honest. We talked about that rapid recovery. So not only are we talking about blueprint, orchestration, and recovery, but we have this concept of a live mount where we actually leverage the Rubrik appliance as a place to recover that data, right? So when we need to get applications back up and running quickly, we're not having to move that data or actually restore it into your production environment. We leave it running on the Rubrik appliance, and we just point that to, let's say, your vSphere environment as an NFS data store and give you instant access back to those apps and data. And then you can always storage vMotion it over if it's something that you want to keep, or if it's something that's like test dev related, you can run your test and tear it down without actually taking the time to provision storage for it and move it into your production environment. And then we certainly are cloud first, so we've got lots of integrations with public cloud providers, on-prem solutions as well for NFS and any sort of S3 compliant archive target as well we support. And briefly for healthcare, right, just to call this out, we certainly support all the major healthcare systems. So Epic Cache is a big one for us. We actually we are the data protection solution for Epic Hosting on their back end. So that's something that, we're proud of and have a deep appreciation and integration for Cache and Epic in general. Also all the supporting infrastructure like Clarity and Caboodle, and really any SQL or Oracle workloads, right? We certainly protect those as well. And then one use case that we've seen more recently is file-based, right? So very large, packs and NAS file systems that are multi-petabyte in size. We've never had a really good answer. The backup community in general has never had a good way to protect that. And so we came with a solution that really redesigned and re-engineered NAS in terms of the drivers that we use. We wrote them from the ground up. They're SMB and NFS drivers, and we're able to scan billions, literally billions of files a day, and move that out to a cloud or an S3 compliant location. So we're not actually backing this up and storing it on a Rubrik appliance. We're putting it somewhere that's more cost effective. But what we've seen with healthcare specifically is the cyber insurance companies are saying, hey, snap and replicate is not a backup strategy, and it's not good enough to just have that replicated to another array in another data center. You need to have it on a separate management plane. You need to have it air gap from your production system. And so this is becoming a hot topic of, how do we protect our NAS data and get it out somewhere else or to the cloud. Real brief, right? I want to talk about M365. This is another area where we've seen a lot of activity, right? It's the same sort of problem that, hey, if my credentials to M365 are compromised, and we're seeing a lot of healthcare organizations getting away from Exchange on-prem and moving to the cloud, how do I make sure that that data is protected? How do I ensure that we can recover if those credentials are compromised, someone gets to my policies, what does that really mean? And so we partnered with Microsoft on this. We identified that they've got some good capabilities, especially their security and detection tools are world-class. But things like retention policies and litigation hold, they're great, but they're not backup strategies, right? And they admit this themselves, right? It's a pointed use case, but it's not good if those credentials to Microsoft are compromised, right? Then those policies can be changed or overwritten or removed. That data can be removed, and there's not really a lot to prevent that from happening. So Rubrik is offering a managed service for M365 where we're providing a logical air gap. So we're storing that data in a Rubrik managed Azure tenant. It's dedicated to you, but again, it's not under the security controls of your Microsoft tenant. So if your credentials are compromised, they're not going to be able to get to this data. But we're giving you, fast recovery, instant sort of recovery capabilities, and being able to do this in bulk if this environment is, compromised. The last stat I saw was about 10,000 users or mailboxes a day. So even if you've got really, really large, M365 environments, we're quite performant with doing mass recoveries and mass restores. And really, I think that's all I had. I know we're kind of short on time. I wanted to leave a few minutes for questions, but I'd love to, anyone that's interested in talking more about this, I'm happy to provide more information. And thank you so much for having me on and giving me the time to speak.
Great presentation, Alan. I really learned a lot. I know the audience did as well. We do have some questions for you. While we take those questions, I'm just going to bring up a poll here for everyone out there. We want to get your feedback on this poll. What additional information would you like about the Rubrik solution? And so let's see. First question I see here that came in, they're saying, they have a relatively smaller organization, and they're curious, would Rubrik be right for them?
Sure, fair question. I guess it depends on how small, right? But we've got appliances that range from 12 terabytes all the way to 120 terabytes, and they stack on top of each other, obviously, if you're larger than that. So, we do have we support organizations of all sizes. And also, if you're sort of cloud-based, maybe you don't have a lot of infrastructure, we support cloud native as well, so you don't even need to necessarily have physical infrastructure in your data center. We can protect your cloud native workloads as well.
Excellent. And then what about, the one here I'm seeing, they're asking, what is Rubrik Cloud Vault exactly?
Yeah, so Cloud Vault is essentially a managed service archive target that Rubrik is providing as a service, sort of turnkey to customers. So traditionally, customers are going to go out and provision an S3 bucket or an Azure blob, and when they do that, they're responsible for the security controls, the consumption of it, the egress if they're downloading data and recovering data out of it. So Rubrik provides that basically as a turnkey managed service. So you're paying, same type of per terabyte or per gig model, but it's a fixed cost. We're never going to charge you for egress or API calls. And we're providing it turnkey, so you don't have to manage the security credentials. It's still air-gapped from your on-site infrastructure, but you're not, managing it day to day.
Excellent. Yeah, sounds like a great option there. Let's see, another question here. If Rubrik is protecting my data, they're asking, what are the options to get that data off-site?
Sure, yeah. So again, it can be a public cloud target. It can be another Rubrik appliance in another data center. It can also be, if you've got some on-prem investments, like maybe some aging NFS storage, again, as long as you have a sort of off-site location, you could copy data there. We also support a number of S3 compliant targets as well. So any sort of on-prem, storage grid, Scality, the IBM solution, any of those we can support for archive as well.
Nice. And then here's an interesting question they're asking. Is there some way to know with Rubrik how long or estimate how long it would take to get my data back if I had to, restore it in the event of a ransomware attack?
That's a great question. So it depends. We do have some tools in the SaaS platform that sort of orchestrates those recoveries. We can give you estimated times for doing some of those scans, for example, to like identify, how long is it going to take us to be able to tell whether we have threats in this environment or not. In terms of actual recovery, that's going to drastically depend on the type of recovery. So there's nothing directly in the UI that says, oh, it's going to take this long. Customers are usually also combining recovery efforts, right? So some might be live mounting where they're just mounting the backup data right off of the appliance, so that's really a near zero sort of recovery time. And then they're moving that stuff over, storage vMotioning it as they see fit. And then other recoveries, probably for less critical data, they'll actually do like in-place restores, where they'll just overwrite the blocks of data that have changed, from the whatever period in time they're recovering from. So a recovery effort is not so cut and dry. There's a number of elements to it. But I'll take that as feedback, actually. I think that would be kind of cool if we could show within the UI somewhere kind of exactly how long or what we think that would take. So I'll take that as feedback. That's a good question.
Yeah, good idea. All right. Well, it looks like we're starting to run out of time here for our live Q&A. There's a number of other questions there for you in the electronic queue. But Alan, it's been really great having you on the event today. Great presentation. Thank you so much.
Thank you. I appreciate it.
And for more information on Rubrik, I encourage everyone to check out the link. It's right there in the Handouts tab. That'll take you over to Rubrik.com, where you can learn more about the Rubrik solution. I see information right here on the homepage about the ransomware recovery warranty, Rubrik Cloud Vault, the upcoming Rubrik Forward Conference, and underneath solutions, there is information specifically around how Rubrik helps healthcare organizations. So make sure that you check that out. All right, if you haven't answered the poll yet, we do appreciate your feedback still on that. If you're having any trouble seeing the poll, I saw a couple of folks said they didn't see the poll. Just push refresh on your web browser, and that will very likely resolve it. And then you can respond to the poll. So we want to make sure that we do get your feedback on the poll question. I'll leave it up while I announce our first Amazon $500 gift card winner. This is going out to Pavan Atur from New Jersey. Congratulations, Pavan Atur from New Jersey. All right, thank you to everyone there who responded to the poll. It's now time to move on, though, to our next presentation on today's EcoCast. I'm excited to welcome Doug Ricketts, Technical Account Manager at Synology. Doug, take it away.
Account Manager with Synology's healthcare team. Today, I'm going to be talking a little bit about protecting and recovering data in your various healthcare IT environments. And hopefully with the information that I give you today, you'll be able to better prepare for cyber attacks or disasters down the road. Before I begin, I want to tell you a little bit about Synology. Synology was founded in the year 2000 in Taipei, Taiwan, as a solutions provider for data storage, backup, and so much more. We then introduced hardware into the equation later on down the road, and our software and our hardware worked in unison to create a unified, license-free system for backup and more. At Synology, we quickly learned that accidents can happen, malicious acts can happen, and many different things can happen at any given time to your environment. They can be simple, and like I said, they can be malicious, like ransomware attacks. They can be natural disasters that could occur at any time, or hardware failure from respected hardware that you've been using for years. I'm going to focus on one thing today, and that's malicious behavior, and more specifically, those ransomware attacks that we've been hearing about much too often in the news. It can happen to anyone from a small business all the way up to a major healthcare provider. This is something that we want to try and avoid from happening, and if it does happen, we don't want you to lose data. I'm going to tell you a little story about an organization that had a ransomware attack in 2021. They ended up paying the ransom, but as many of you know, ransomware is designed to cripple your system by encrypting all of your data on your network. Once the data was encrypted, they decided to pay the $5 million ransom. This organization was able to sustain the payment of a $5 million ransom to obtain a de-encryption key from the ransomware attackers. After that, they noticed that the decryption was slow. The tool provided really didn't help them with their RTO. So, in the end, they ended up using their backups anyway. The good news is that the organization had sufficient backup recovery strategy, and that strategy was indeed their last line of defense against the ransomware. Ultimately, they elected to pay the $5 million. Was that a bad decision? No, they just used that decision with the information that they had at the time. From here, we see a timeline of events that could occur in a ransomware attack. We see we're taking snapshots of the data every 5 minutes. That means that when the incident occurs, there's a probability that you could go back to a point in time just 5 minutes prior to the incident, meaning that your RTO and your RPO is preserved with an efficient backup strategy. The restore point brings you back to the 5 minute point right before the incident occurred. To better understand how this backup and recovery solution was implemented, I'm going to talk about an orthopedic implant developer that recently used on-premise backup to protect their systems. This orthopedic implant developer had critical operations data running on a server, and it spanned across many different scattered systems like PCs, VMs, SaaS, and even in the cloud. Additionally, they had a number of company employee data on there. Their mission and their desire was to unify their backups and create a single point where they could quickly access their data in a disaster situation. So they needed a unified backup solution, and that ended up being an on-premise backup system. So with all the options of cloud backup out there, why backup locally? Well, this particular organization was able to reduce their recurring costs by $60,000 per year compared to their cloud subscription services. Additionally, admins had better access control over that data that was on premise. And with HIPAA rules and HIPAA laws, we want to make sure that that data has least privilege access. So people that don't have access to that data can't get access to it. Those servers are locked, and those servers only have the users that are able to access that data allowed to access it. Next, recovery was slow with a cloud service. An on-premise backup was able to give a faster recovery, RTO, than a cloud solution ever could, because it'd be limited to the amount of incoming internet speed. So I'm going to talk a little bit about a solution that I know and I use on my Synology, and that's called Active Backup Suite. I'm going to talk about the strategies that we use to protect on-premise data to an on-premise repository. Active Backup is an incredibly smooth program to use, very easy to understand, and it's a centralized data protection system that allows you to protect your PCs, your physical servers, your file servers, and VMs. There's no license fee and no subscription costs to using this solution. For Synology, it simply comes with the device. So what I'm going to do is show you how to protect your data from the lens of a physical server on DSM. Here we have DSM, Disk Station Manager. Disk Station Manager is our proprietary operating system. What I'm going to do is I'm going to go ahead and open up Active Backup for Business. Active Backup for Business greets you with a very smooth overview of everything that's going on in your system. You have information such as all of your protected devices, your virtual machines, your physical servers, and your PCs as well. You have a backup calendar, and you have storage status so that you know exactly how much data you're using through Active Backup on the Synology NAS. Now, in addition to telling you how much data your device has, it's telling you space saved by deduplication and compression as well. So what I'm going to do is I'm going to go to my physical server environment here, and I'm going to select a physical server that I have backed up to this device. Then I'm going to go ahead and create a task. Now, as we see here, this is a Hyper-V server that I'm actually backing up, which is running virtual machines that are likely backed up here. I'm going to name the task Virtual Machine Server. Then I'm going to elect to back up the entire device, because later on down the road at the recovery portion, Active Backup for Business is going to give you the ability to do a bare metal restore. Now, per HIPAA, I'm going to enable data transfer encryption. I'm going to disable compression because when I access that data, either in transit or on-prem, I want to be able to unpack that data really quickly. So we're going to go ahead and click Next. I'm then going to select a shared folder that lives on my Synology NAS that has encryption available. I'm doing this because my data has to be encrypted at the backup destination. I'm going to enter in my password. It's amazing what a capital letter can do to the strength of your password. We'll go ahead and click Next. Now I'm going to enable application-aware backup so that we ensure that we don't have any issues or corruption with ongoing activities when backup is happening. Also, I have the option to enable backup verification. This is just a small clip at the duration of your choosing to back up and spin up on the NAS to prove that the entire image was actually transferred to the NAS. Some healthcare providers require this for proof that that data is secure. I'll go ahead and click Next. Then I'm going to go ahead and schedule my backup to run hourly. I'll click Next. Then I'm going to enable retention policies, and our retention policies range anywhere from days to weeks to months to years, including the amount of versions that I want to keep. Click Next. Now I'll go ahead and assign Devon restoration privileges. Click Next. Now we get a nice little overview of everything we just assigned. I'm not going to click Done, but in the event that I do, the backup would start if I prompted it to, and my task would be created, and from then on out, it would begin to run every hour. So really, it's easy as that to create a backup strategy through Active Backup for Business. Now, after your device is backed up, the next step is safely recovering a system after a ransomware infection. Well, the first thing you want to do is you want to isolate the infected device. That means take it off the network and make sure that it won't spread. Next, you want to wipe and restore the device. When you wipe the device, that means that there's no access to your data on that device ever again, unless you have it backed up. So be careful to have that efficient backup strategy in place. Then finally, you want to test and restore that device. Recovery time generally equals the data transfer and installation times each attempt. So that means you want to make sure you're efficient as possible when restoring that device. Otherwise, you could be down for some time. Now, I want to turn your attention to options that some providers, as well as Active Backup, have to offer. First, we have granular recovery options from full system restores, file level restores, self-service file restores, and even all the way down to an instant restore to Synology Virtual Machine Manager. I want to turn your attention to the last one. Instant Restore to Synology Virtual Machine Manager allows you to actually virtualize your downed PC or server or virtual machine directly on Virtual Machine Manager. Virtual Machine Manager is our proprietary hypervisor. Then you can run that PC or virtual machine or VM as a virtual machine directly on VMM, which we call Virtual Machine Manager. Now, your recovery time equals your time to boot up the VM, which is significantly less than recovering directly to your original system. This is a temporary recovery to allow you to check your systems in an isolated environment, as well as give your users access to that system. I'm going to go ahead and show you how we can virtualize that environment that we just backed up. So here I have my virtual machine, my Hyper-V server that I just backed up, and it was successful. What I want to do is restore it to Virtual Machine Manager. I'm going to go ahead and click on that, and I'm going to click the Restore button. Then I'm going to select a point in time prior to the attack. In this case, we've got one thing prior to an attack that may have happened, so we'll click Next. Now I've got two options here. I can restore it directly to my VMware Hyper-V server, or I can do an instant restore to Synology Virtual Machine Manager. That's what we're focusing on right now. So we'll go ahead and click Next. After clicking Next, we're going to select the storage repository. There's a cluster here at the location that I'm working from. So I'm just going to go ahead and select the unit that I'm actually working on right now. I'm going to click Next. Then I'm going to assign the amount of resources that system is going to use to run this Hyper-V server. This is limited to the amount of RAM that's in the Synology device. Now, this can be scalable all the way up to 512 gigabytes depending on what unit you're using. We'll go ahead and click Next. Then we'll see we have two virtual disks on your VM server. I can't modify this because this is just something that's inherent to the backup. But I have enough storage space on my NAS to allow for a thickly provisioned LUN there. Go ahead and click Next. Then I'm going to go ahead and select the default VM network. We'll click Next. And then I'm going to assign any type of virtual keyboards and also auto start as well. We'll click Next. Now for power management restrictions and permissions, I have both domain users and local users. What I'm going to do is I'm going to select my domain users. So I have this NAS integrated directly into my domain. I'll click Next. Then I'm going to go ahead and click Done after reviewing everything and elect to power on the virtual machine after creation. Great. So now that I've got it restored to Virtual Machine Manager, I'll have access directly to my virtual machines. So here I have Domain Controller. Now, that wasn't the exact unit that I backed up, but I'll give you an example. I can actually connect to that. Once connected, I have a lot of flexibility in terms of what I want to do with this. I can use it just as I would any type of VM that's actually running on an actual hypervisor or directly on the VM server. Pretty quick solution to making sure that your environment's protected. Just kind of a discussion on avoiding single points of failure. We want to retain weekly, monthly, and yearly versions of all your backups. Additionally, we want to back up multiple locations and replicate off-site as well. And we want to maintain good IT admin hygiene in general, like not saving your login credentials, don't use remote desktop software for critical systems, and others. The orthopedic implant developer had a really nice on-premise backup, but their secondary backup was essential. What if the primary backup is compromised? Well, the backup repository living on the primary backup, with it pointed to a secondary backup, allows you to actually fail over to a second site. Using active backup, we can then spin up the image, just like we did earlier, of the second backup by linking the repository. And then your replacement device is allowed access to restore on-premise. So during the restoration process, you have no lapse of services. You may have about 15 to 20 minutes or more depending on the amount of data, but at that point in time, you're still able to restore your systems and use them temporarily. Recovery time is initially going to equal the initiate failover and restore to new device. Snapshot replication is the solution we use there. I'm going to go ahead and set up replication on a second NAS. So here I have my NAS open. I'm going to go ahead and open up my snapshot replication solution. Then I'm going to click replication. I'm then going to app active backup. I'm going to go create. I'm going to click start. I'm going to select a remote folder. And then because I'm connected to VPN to the other servers, I should easily be able to find those servers. I'm going to go ahead and select slab DVA. I'm going to enter in my username and my password. And I'm going to select to use an encrypted connection. Again, because HIPAA requires this. We'll click next. I'm going to select the volume, the data to replicate, and then it's going to give me a nice little overview of how long that's going to take. I'll click next. I can back this up as frequently as every 5 minutes, just like the solution we saw earlier. I'll click OK, click next. Then I can do my advanced retention policies, and we'll click next. After I've configured the snapshots, we'll look through everything, click done, and in this case, I'm not going to click done. So there you have it. Snapshot replication has then replicated its data to an off-premise NAS and allows you to back up. Now, some considerations for HIPAA when backing up. You want to ensure that you have access control for least privilege for specific users, as well as password strength rules, data encryption on all of your transfers and all of your at-rest data, as well as in-place administrative practices such as BAA. Just so you know, we do offer a cloud service called C2, which does have a BAA involved with it. We also have physical safeguards that you want on the device, such as locked hard drive trays and being locked in a physical location. If you have any questions, feel free to reach out to us. You can contact us directly, and you can be sure that we'll actually be following up to see if you have any additional questions. Thanks so much for your time, and we really look forward to talking more about you and your healthcare IT environment. Have a great day.
All right, excellent presentation. Really love you taking the time there to show us a demo, Doug. I enjoyed that. I'm sure the audience did as well. Yeah. I've just brought up the poll question for everyone out there that says, what additional information would you like about the Synology solution? We do want to get your feedback there on that poll. And let's see, Doug, I guess I'll just go to the first question here I see, which is from Sean in the audience, who says that he heard that tape was the new unhackable. Is this something we should really be paying attention to?
Sure, yeah. I mean, tape is a very secure way to back up any type of VPHI or data really in general for safekeeping. However, typically restoration times is often going to be relatively slow and costly if done through a third-party provider. Additionally, tapes are a great way to ensure that your data is air-gapped. You can kind of create a very similar strategy with a NAS as well. And that's going to give you some faster RTO times. I do want to point out also that tape isn't necessarily unhackable, because if you don't eject the tape cartridge after like a malware attack taking over a server, it could really just simply wipe the tape out, just like any other type of backup. But really, that said, I mean, with proper implementation, tape backups can be very effective and definitely carried off-site. And in that case, they're typically very hard to destroy.
Absolutely. Yeah. Very cool. Let's see. Yeah, it did. Another question here, they want to know, can Synology help us backing up our Microsoft Teams data?
Yeah, so we can definitely back up Teams data that is being stored on either OneDrive or SharePoint online. So it's OneDrive for Business or SharePoint Online. And certainly we can get some materials sent out on how to better do that too as well.
Nice. Yeah, that's cool. I bet a lot of folks didn't know that Synology can back up Microsoft Teams. So I'm learning as well as the audience. Another question here. I know Synology has a lot of different models of NAS available. Can you offer any advice on which one to select?
Well, I mean, certainly, if you're in the healthcare environment, we do have a dedicated healthcare team that can help you and certainly connect with you to discuss any type of deployments you all are looking at doing. You can contact us at Customer Success Squad, so customer_success_squad at synologyamerica.com. But we also have a variety of online articles. We have a knowledge base that can kind of help you work with that decision and really help you be successful in what you're deploying. But don't ever hesitate to reach out to us, and we can certainly help you architect a solution that would work very well for the environment you're working in.
Excellent. And then when it comes to protecting Microsoft 365 data, they're wanting to know here, is there a specific plan that would be compatible with this?
Yeah, so with Microsoft 365, typically our business, enterprise, any of our education, and also our Exchange Online plans are going to work with the Synology NAS. So pretty expansive, but you want to think sort of business oriented plans when backing up to the NAS.
Got it. Okay. And then the follow-up question here, any limit on the number of accounts?
No, that said, I think in terms of Microsoft 365, if you're backing up more than 500 accounts, I would definitely consider reaching out to Synology directly. And we can, A, help you with the deployment specifics and help you get something that is going to work well. And then, B, we can also assist you in that process too. Because we are a multi-tenant solution, you may have various tenants that you want to put on the NAS. So, yeah, certainly something that we can help you do.
Nice. And then what's the licensing model they're wanting to know when it comes to Synology and protecting these sort of SaaS apps?
So the licensing model is, I would say, about 99.9% of our solutions are going to be license free. So essentially when with Microsoft 365 or with Google, that's not going to be a licensed solution. That's actually free. It's included with your purchase of the NAS. It's not going to actually cost you anything in addition to try or use. It's just an extra layer of defense, and it could effectively help your organization save quite a bit in backing up or archiving data that you may not ever use again, that from an employee who's worked at the organization, EPHI, anything like that. But most all of our solutions are going to be license free.
Awesome. Yeah, that's very cool.
Yeah.
All right. Well, Doug, I'm afraid that's all the time we have here in our live Q&A session, but a really cool demo. Thank you for taking all the questions.
Absolutely. Thank you so much. I appreciate it. Thank you to everyone.
Absolutely. And thank you to Synology for being on the EcoCast today. Check out the Handouts tab, and it's there that you can download a PDF resource from Synology entitled Protect Your Data and Excel in Care, specifically around ransomware, data protection in healthcare organizations. So make sure that you check out that resource. All right. Hopefully you've... Absolutely. Yeah. Thank you, Doug. And hopefully everyone out there has responded to the poll. We do appreciate your feedback, but it's now time to move on to our next presenter on today's EcoCast. Welcome now to Matt Wallace, CTO at Faction. Hey, Matt, it's great to have you back on.
Hey, good to be back on. Thank you very much.
Absolutely. Take it away.
All right. Well, thanks everybody for joining. I was just having a conversation with one of the Synology folks about how I've been a happy customer for over a dozen years with one of their units at home. So need to be following on with that. Today, I'm going to talk to everybody about what we call practical multi-cloud for healthcare and life sciences. And I'm excited because, first of all, I think healthcare and life science is probably the largest vertical right now that leverages Faction's multi-cloud data services. And second of all, I've been personally involved in some really, really fun projects, one of which I'll recap again for those who've never heard me talk about it before, really just exciting things that we've done around some of these opportunities. So tiny bit about Faction here. We've been around, a long time now. I've been here about 6 years, and the company's really transformed lately. We have, about 10 patents now. I think 9 are granted, 1 is pending. Really a huge amount of data under management, and we haven't taken an official tally lately, but I actually think this is getting close to an exabyte of data now. But, really great partnerships, across some of the major tech players, including Dell, who, through Dell Technologies Capital, is an investor in the company, and then lots of exciting stuff going on with, of course, the cloud providers, where we provide a lot of value in the public cloud. So let me talk just a really brief amount about data challenges today. And after I can get through kind of telling you what I'm seeing from customers, then I can talk a little bit about what we do. So the first thing is we've seen that people are having bigger problems with collaboration. And some of that's because data gravity makes it hard to move data. They're forced to copy it. But also, as much more data has moved to the cloud and as application stacks have gotten a lot more oriented around microservices and API frameworks, we see a lot of cases where many enterprises have dozens or even hundreds of application teams that are leveraging the same data. And then even outside of the enterprise, we have one customer in the life science space that started off very all in on Amazon, but they wanted to partner up with a huge body of genomic data that they collected. And they wanted to do it with a partner that was only in Google Cloud, that only could use a workflow in Google Cloud. And so they came to us partially because they were looking for a way to not disrupt what they were doing already with their teams in AWS, but they really wanted to expose some of that data into GCP as well. A second thing here is around innovation. And a lot of this just has to do with the fact that people go to the cloud for innovation to begin with. But with this huge variety of services, both from a hardware perspective, we see things like TensorFlow processing units or AWS Graviton chips or Trainium chips, et cetera, as well as software innovations where you see completely different things going on in terms of PaaS level service in public cloud. You see different teams, different parts of enterprises really want to leverage different clouds for good reason, because there's differences between those services. But how do they do that without having to move or copy data? It becomes a bit of a problem. And both of those things really tie into cost as well, right? At some point, one of the ways to deal with wanting to leverage multiple clouds is just having many copies of the data. So that can be excruciatingly expensive. Plus, we see lots of people want to move data into the cloud, but if they've got one copy of it, they also want to send piece parts of it elsewhere. And so egress charges, network transfer charges, those sorts of things can create really unexpected as well as high costs for moving data around. And then finally, and maybe most significantly for those who are dealing with data at large scale, especially thinking petabyte plus, we find that there are challenges around governance. And if you look at some of the ways that people have solved some of their data challenges classically, it can often look like a scale-out architecture. So they might use a service that can hold file data, but they might go and use 20 copies of a virtual file server or 100 copies of a virtual file server. And now they have 20 different things to manage. And if they're in multiple clouds, one thing we see, for example, with our object data service, which is S3 compatible, is we see people who are leveraging both AWS and Azure and GCP for object data, and they're storing metadata with that. But what they're not doing is they're not having some sort of unified way of dealing with metadata. And so you get metadata tags that are used to say, well, where did this data come from? How long should we keep it? Who is it owned by? And all sorts of other things. And the metadata typically is stored with the objects. And yet if you have 3 clouds, then you have 3 different ways to store that metadata, and that creates a governance problem. So all that having been said, let me tell you a little bit about our core product and how we solve for things. And if you look at this diagram at the bottom, it'll give you a clear view here. We have our cloud data service, which would be called the cloud control volume. And it gets presented, with 5 different ways for 5 different use cases, right? A standard file service, which is good for home directories and smaller footprints. What we call file scale out, which starts a little bit bigger, but can then scale to as much as 60 plus petabytes on a single file share. And I'll talk a little bit more about that. Block services, which are useful specifically for the applications that require block. And sometimes it's things that intentionally, can share block devices across clusters, things like data warehousing solutions. Object services, which is actually, I would say, the bulk of interest right now. This has actually become the most popular variant of our product. And then data protection, which is really interesting as well. And it's based on Dell's data domain. And so it is a way to deal with long-term retention, but with absolutely astronomical dedupe. And not every tier applies to every type, but we've got 5 different speeds from archive to turbo. But the key thing that you'll gather here is that it's one copy of data, and it connects across our patented network fabric, which we call the Faction Internetwork Exchange, where every customer gets a virtual private fabric. You can kind of think of it like an AWS VPC, for example. And from there, they can use our portal and APIs to provision network swim lanes from that volume of data, that data service, into each and every cloud, and in many cases, many clouds. So for example, a couple of months ago, we worked on a scale-out architecture for a customer so they could connect over 1,000 VPCs back into the service, scaling out with many virtual interfaces across many different sort of direct connect connections going into many direct connect gateways, providing that same access to data across the environment. And it's compatible in many cases with on-prem solutions. So through our partnership with Dell, many of these things are based on Dell hardware. And so, for example, people with ECS or ISWAN, which they also call PowerScale now, on-prem are able to actually replicate that data directly into the Faction Cloud Data Service from their on-prem equipment and then leverage that directly in the public cloud. And once you're connecting this volume of data through Faction's fixed network, that network fabric, you can access it from all of those clouds simultaneously. And so it really does look exactly like a mount point that you can connect to, and you'll see this in some of the slides here. So I'm going to go through 3 use cases real quick, but I'd like to run a little poll here and kind of get some inquiry from people about what kind of data challenge they see the most.
Absolutely, yeah. The poll on the screen I want to call everyone's attention to is basically, what's your largest data challenge? Is it managing ever-increasing data? Is it data protection from ransomware, cyber attacks, and more? Is it making my large data set work in a hybrid or distributed environment? Perhaps it's managing data governance amidst increasing data sprawl. Or If there's something that's not listed on there that is your largest data challenge, drop it in the questions pane, and we will share it with everyone and use it to improve our poll here in the future.
It's really interesting. I actually honestly expected other to be the most popular in some ways, but this is really interesting for me to see.
Yeah, lots of good responses coming in here. Let's get just a few more. I'm not going to tease the responses so as to not skew the results. But it looks like a good portion of the audience has responded, so we do appreciate your feedback. Let me share the results of the poll now. And it looks like 47% said data protection from ransomware and cyber attacks, followed by managing an ever-increasing data set. What do you think, Matt?
Yeah, I mean, I think amazingly even distribution, honestly, working there. And, you know, these are all things, of course, that we see. It will be fun to kind of talk about the data protection in the context of some of these examples. So the first thing I'd like to use as an example here that's healthcare related is transformation of record systems. And obviously EMR is probably the biggest use case here, right? But let's talk about, you know, how this works. And you can see a little bit more of a deeper dive here as you see the cloud control volume in the middle. And you can see how Faction actually manages all of the things that produce the data service, manages all of the connectivity as well, right? So the experience here, you know, might be go to the portal and say, I need to connect to Amazon. You put in your Amazon account ID, and then you get interface requests. You just accept them and everything comes up. So there's nothing to buy or configure, and all you really have to do is attach it to your, you know, direct connect gateway or virtual gateway, both of which are free constructs that Amazon provides for that attachment. And it's all included in part of the service, and you can re-provision it on demand. So that's powerful. But also what's powerful is, you know, we have a number of large healthcare organizations that are now leveraging us for EMR solutions. And I think one thing that's really powerful there is the fact that we can put, you know, as much as 10 to 60 petabytes on a single file system that can be accessed uniformly and actually multi-protocol. So if they have apps that need NFS and other apps that need SMB, and then another app that needs S3 object access, they can access the same copy of the data with all those protocols simultaneously, which is very powerful in the first place. But then also the fact that you can get, you know, the full throughput and horsepower means, you know, collectively having many petabytes of data means that we can drive enormous amounts of throughput. And so this is the basis for one of the customer case studies. And I don't know if we have a slide in here about this anymore, but we actually have a customer that kind of transformed their entire hospital system recently along these veins. So, second thing we're going to talk about here is data protection. And so I love that somebody, you know, that one of the most popular answers in the poll was about, you know, protection of data. Now, of course, you know, we see different use cases here. We see both super long-term retentions. And I have one customer that has now written over 700 petabytes of data into our platform. I actually included a screenshot from our backend where they're getting deduplication of over 100 to 1 right now. So no promises there, of course. That's a very specific, you know, set of data for them around incremental backups, but still incredibly powerful construct when you think not only can you get incredible dedupe, and that's, you know, passed on to our customers with this service, but you have this ability to deduplicate before you write the data with this. Since this is based on Dell's data domain, things that leverage that protocol to write into the system are able to deduplicate data before putting it on the wire. So you think writing incremental backups as offsite backups out of the cloud, and now you're able to really only write the changed data, which saves you a lot on egress charges, as well as giving you this sort of sovereign external copy that you can recover from. Lots of features here around things like write-only media, and in fact, even with some of the solutions that we have where we can extend it to a true cyber vault where it actually gets an air gap that will programmatically open and close, so it's not attackable, you know, and it's only really online while new data is being written. Come with things like dedicated security administrators, right? Even a regular admin can't go and flag worm data for being deletable. So very powerful there in terms of compliance. And then finally, you know, we actually have this data protection, and we can tier it down into our object CCV as well. And so, you think about that, if you're writing to a file system, or a data domain system that's getting 100 to 1, or even some reasonable but high number, call it 20 or 30 to 1, but then you're also able to tier that into object, you're essentially cutting the cost of all these backups and long-term retention things enormously. So that's a very, very powerful solution for healthcare and life sciences, where we often find people have really substantial retention requirements. And so something that can make that economical is very important. Now, the third one, and probably the most exciting one for me, is this multi-cloud genomics supercomputer. And so this is away from kind of traditional healthcare and talking a lot more about life sciences and what we've been able to do in terms of enabling research here. So we built a multi-cloud genomic supercomputer about a year ago. We ended up presenting about this at BioIT World. And so if you participate in that conference, of course, and you're in life sciences, I'd recommend, going back and checking this out. But what we were able to do was basically take hundreds of instances across all three major public clouds in Northern Virginia. We used them with the same genomic data set. We downloaded the entirety of the 1,000 genomes genome archive. And then we were able to leverage that to kind of show this high performance compute workload, where we built a supercomputer that's stretched across clouds. And I'll show you some screenshots here. This is an actual view of the kind of dump of the cluster manager on the left and right. And you can see here instances from Azure, instances from GCP, instances from Amazon, all running in the same cluster at the same time. The controller for this cluster was running in Azure. But, true network communication across all of these. This becomes a really powerful construct specifically because of spot instances, and I'm going to show this next screen here. So if you see, everybody knows, of course, that if you can make a commitment to a 3-year reserved instance in public cloud, it's much more economical than doing anything with on-demand. But if you can use spot instances, you can save much more. And you can see here with this particular instance type that we used a lot of in this project, not exclusively, this is the Azure instance, that the spot instances themselves were 74% less than the 3-year reserved cost, which I think made them something like 91% or something off on demand, something pretty astronomical. And so the problem with spot instances, though, in a multi-cloud environment or just in general, is the fact that if there's a run on capacity, then you could have your workload completely shut down. And this actually happened. This preemption effect happened to us a number of times in the project. At one point, we had almost 300 GPUs running in Azure that were trimmed to zero almost instantly, all preempted. And then at that time, we couldn't even get another on-demand instance, let alone a spot instance. But by stretching across 3 clouds, if one cloud has a run-on capacity and suffers from preemption, you can scale up in the other clouds. And so multi-cloud not only gives you more total scale, but it also buffers you against the impact of those sort of sudden preemptions. So you're actually able to realize this massive savings, and think of what you could pay for if you can save 75% on compute. Really amazing for these batch workloads as well. Now, of course, normally to do this, you would need 3 copies of your data, because it's not easy to access your data in real time out of Azure if it's sitting in Amazon, and out of GCP if it's sitting in Azure, and so on. Well, leveraging faction service, since the same single copy of the data can be read from all these instances across all the clouds at the same time, you can see we're able to take our service, which is less expensive than any of the 3 comparable services in each of the public clouds, and actually have a single copy. And so it's 90% almost off of what you pay for the 3 copies across the clouds, even though it's a savings across each of the clouds in general. So really powerful capability there. And this is something we see people doing in real time. So if your organization does a lot of HPC type workloads to do life science work, whether it uses CPUs or GPUs, and we've seen both using things like Parabricks from NVIDIA on the GPU side for genomics, or just using massive CPU farms for, say, RNA research where Parabricks doesn't function yet. These are all really powerful things here that we can enable from a supercomputing in the cloud perspective. And so I'll just close off with one kind of screenshot of just our portal and the management interface. And you can see this is a relatively simple one, because this little lab example only has, one connection to each cloud, but it gives you the idea of being able to look at a little volume and being able to see where it's connected and how, and so on and so forth. And so that's a huge amount of complexity that goes away, right? Because you're not having to manage any of the networking. We're monitoring all these things. You're not having to manage BGP sessions, and the security, the isolation, the traffic segmentation all comes from those 10 patents that I mentioned that Faction has earlier. And so it really enables you to have this turnkey multi-cloud solution where, your Faction data looks like an S3 object endpoint, or it looks like, an EFS file system, to kind of use some Amazon-oriented examples, except it can be accessible from all the clouds at the same time without having to move or copy any data. And we do that, of course, by having all of our services run out of data centers that are extremely close physical proximity to the public clouds, where you've got dark fiber in these dense metro areas that can have this high speed, low latency networking that connects them all, which is what we've completely optimized for. So with that, I am very happy to take questions and thank everyone for their time today. And do please reach out if any of these strike a chord with you. We'd be more than happy to discuss some of them. And we can even kind of talk about some other use cases, like, for example, how we've helped people lately move some of their Epic environments up into the cloud and solve for problems using things like Epic Cache or Epic Iris in the public cloud, and so on and so forth. Thank you very much.
Yeah, great presentation, Matt. We do have some questions for you from the audience. While we take those questions, I'm just going to bring up this poll for everyone that says, what additional information would you like about Faction? And so that was really fascinating to me, Matt, the multi-cloud made easy, because I know, a lot of companies talk about doing multi-cloud, but it doesn't sound very easy. So it's really fascinating to me that you guys have these patents that have made multi-cloud so easy, because it sounds like it could help a lot of folks, but it's not always easy. So that sounds unique, and I like that idea. Also, running Epic in the cloud sounds like something that could help a lot of folks, specifically on this event here today. Let's see. First question I was going to ask you, they're wanting to know about HIPAA compliance. Is Faction HIPAA compliant, and do you sign BAAs?
Yeah, that's a great question. I kind of want to say, of course, because it'd be silly to be presenting to this audience if we didn't. But yes, Faction's had HIPAA attestations longer than I've been around. So I've been here almost 6 years, and we've been undergoing HIPAA audits and signed BAAs that whole time. We're also Type 2 SOC 1, Type 2 SOC 2 compliant as well, with attestations available for those. We're going through a high trust audit actually right now as well. And long story short, I've actually had a bunch of conversations with people who, have wrestled with some of the challenges that we're talking about here, especially access across many clouds. And, one of the things that comes up is they ask questions. They have some idea basically about how they can build it themselves, right, or how they can solve a problem. And it's not that it's impossible. Of course, like, we're very fond of saying, why would you spend all this effort going to the cloud to consume a bunch of cloud services and then do this incredibly complex multi-cloud thing, not as a service, but building it yourself. But the conversation usually ends when I ask, and are you prepared, when you're done, even if you were to be successful in this, would you be prepared to go through an audit? And the answer is usually, oh, we really don't want this to be in scope. So having something like our service, which is already audited and turnkey and ready to go, can be really exciting for people because it just means it's one less thing to worry about.
Yeah, absolutely. Another question, how long has this been around, and what does a typical customer look like?
Sure. The very first version of our multi-cloud data service launched at the tail end of 2016. And we've done a bunch of iterations then, and I'd say, the service as it looks now underwent a pretty substantial change, probably 2018, because that was when Dell Technologies Capital invested, and we actually started leveraging a whole bunch of interesting capabilities from their backend systems as part of these services. So things like our ability, to attain this 100-to-1 deduplication isn't something we can do without that sort of proprietary backend that they supply us with, and so that's pretty powerful. I would say what's interesting is, our typical customer just feels like it gets bigger and bigger and bigger all the time. I would say our typical, entry point now is probably in the 2 to 4 petabyte range, for somebody in terms of data. But I mean, it can skew much, much higher than that. I have a customer I'm working with right now that we're just kind of tying off on their initial footprint, and it looks to be somewhere between 35 and 45 petabytes. So obviously massive amounts of data there, tons of retention, a lot of interesting things going on. And so you get a feel for certainly, data gravity is not a problem you have when you've got a couple terabytes of data, right? I'm not even going to recommend somebody look at us, but as you get to petabyte scale, that's the problem we were oriented around solving, and where I think we just deliver just an unbelievable amount of value for people in cloud environments.
That's incredible. 35 to 45 petabytes of data. Wow. I mean, we don't have to talk about scalability.
Yeah, and like I said in that one slide, we have one customer who's written now almost 700 petabytes of data into the data protection service. So unbelievable scale of data there. And that's a massive hospital system basically is using it for long-term retention.
Excellent. And what about security? There's a question out here around securing the data when it's in the Faction cloud. What features are available for that?
Sure. Well, I mean, I think the most important thing to keep in mind here is on top of the thing we talked about earlier in terms of, hey, this is a compliant solution. Keep in mind that all of this is completely private, right? So although we show, optional connectivity to your data center, optional connectivity to the internet for something like object service access and so on, because we are by default connecting completely private networks on completely private virtual private fabrics, with all that isolation backed by the patents tied into your cloud environment over private connectivity. Right? These are physical, logical, operationally controlled in a way to keep them completely private. Security is one of those things where I think what I would say is a lot of our customers are actually treating this completely like it's private networking. And so that's a great thing from a security standpoint. That having been said, we have multiple architectures too for layering in additional security. And that could be anything from putting appliances inside of the cloud environments to secure those. Faction, along with the cloud data services, also runs compute services that are fantastic for running things like virtual appliances. And so we can turn up things like virtual firewalls and virtual load balancers and things of that nature so that people can actually then take, whatever sort of standard they have for appliances, be that, Checkpoint or a Palo Alto or whatever, and layer those in. And people use them for SDN purposes as well. So we have customers that use things like Aviatrix, for example, for software-defined networking in between clouds, and they're able to terminate an endpoint in Faction very seamlessly and kind of blend that into their existing SDN contract. So all those things give them some ability to do security services. And on our side, of course, we have over 100 physical, logical, and operational controls in terms of, monitoring, anything from employee background checks to multi-factor authentication, most of which ties back into our compliance audits, of course. But, we're doing the utmost with those best practices to keep things secure on our side, and then doing our most to kind of keep it possible, I guess I'd say, for customers to construct the security measures that they need on their side.
Excellent. Excellent. Well, Matt, I'm afraid that's all the time we have in our live Q&A session here. Really great presentation. Again, always excellent to have you on. Thank you.
All right. Thanks, everybody. Appreciate your time.
And thank you to Faction, of course, for supporting the event today. Check out the Handouts tab, and it's there that you'll find an ESG paper on solving big data challenges with multi-cloud data services for Dell EMC PowerScale. It's a paper you can download, lots of stats and diagrams and resources in here. So make sure that you check that one out for additional information. And of course, respond to the poll question there on the screen. I will leave that up while I announce our next Amazon $500 gift card winner. This one's going out to Julie Barnes from Kansas. Congratulations, Julie Barnes from Kansas. Still one more gift card to give out on the event today. And of course, don't forget about our best question prizes. We're doing Amazon $50 gift cards, one for each of the Q&A sessions on the event today. So that means we've got two more Amazon $50 gift cards still to give out on the event just for questions alone. All right, so with that, it's time now to move on to our next presentation. I'm excited to welcome J. Wolfgang Gorlick, Advisory CISO at Duo. Wolfgang, take it away.
Hey, hello. Thanks for joining. This session is on security outcomes, a study that Cisco and Scientia did. And specifically, we're going to be slicing and dicing the data to look at healthcare organizations. My name is Wolfgang Gorlick. I'm an advisory CISO, and today I'm presenting on behalf of Duo Security, now part of Cisco Secure. So what we're looking at is this study, this very important study that asks the question that I think all too oftentimes we haven't asked, which is any of the stuff we're doing actually work, right? We all have patterns and practices we picked up over the years. We all have our own lucky rabbit, that process that absolutely must get done, that person that you hire every time you come to a new company because they've been very successful with you in the past, that control that is your ride or die. We all have our lucky rabbit's feet. But it's been very difficult for many years to get any good data as to what works or what not. So that's what we set out to find with Scientia. So in 2021, Scientia and Cisco did a study. We looked at nearly 5,000 people across 25 countries, all different orgs and industries, and effectively asked the question, what works, right? What are you doing and what are the outcomes you're getting? And of course, we sliced and diced it even further to pull out healthcare. So across that data set, we looked at nearly 300 healthcare organizations and could do some really interesting compare and contrast as to what the differences were, what the strengths were, what healthcare can learn from other organizations, what other organizations can frankly learn from healthcare providers. This bubbles up into effectively 3 outcomes, and these 3 outcomes make a lot of sense if you look at where chief information security officers come from. Where do you come from? where did you get your start? Where did you pick up that lucky rabbit foot? And the data shows that, and this data, by the way, is industry data, not security outcome study data. The data shows that effectively there are 2 career tracks for a CISO. One is the SecOps track. You get really good at building programs. You get really good at instituting metrics. You get really good at acquiring, retaining, developing talent. That's one track. The other track that CISOs follow is GRC. You get really good at identifying risks, understanding compliance mandates, figuring out where the controls need to be implemented. And so in those 2 tracks, what a CISO is doing effectively is enabling the healthcare provider to do patient health and safety. And there's lots of outcomes underneath that, right? Keeping up, gaining trust, peer buy-in, creating a culture. So these were the high-level security outcomes that we looked at. Now, one of the questions that I think a lot of people oftentimes want to know is, hey, how does healthcare measure up? How do we stack up against other industries? So I want to start with showing that data, and then I'm going to delve into these outcomes a little bit further. So when we plot out healthcare orgs and compare them to other orgs, one of the things that's interesting is those top 2, right? The GRC track, as I mentioned, enabling the organization. Those are where healthcare organizations tend to do the best. Meeting compliance regs, probably not surprising, as that's been a big driver for 2 decades now, ever since HIPAA hit the street. Gaining executive confidence, 49% easier to achieve success. Avoiding major incidents, also much better from a healthcare perspective. There are, of course, some areas that healthcare organizations struggle, retaining talent being one of them. There could be a number of different reasons for that. I was told once recently in a healthcare user group that they had hired some folks out of government, and their new teammates were like, we thought we had limited budgets in the gov space. This is unprecedented. We've got so few things to work with here. So there may be because we got cost pressures, right? There may be because we've got some tech challenges that it's harder to retain talent in that space. more difficult to obtain peer buy-in. And that one, you'll see as we talk through today, is actually one of the more impactful outcomes for driving a number of different downstream initiatives. So just keep this context in mind as we go forward. There's some areas like managing risk that hospitals and healthcare providers do much better. There's other areas like operating efficiently that tend to be a little bit of a struggle. So of those 3 outcomes, effectively 11 sub-security programs outcomes underneath it, we looked at 25 different security practices. And the goal again was to say, okay, what security practices are correlated to which outcomes? In other words, if I want to do a particular outcome, what practices should I strengthen up on? Another way I like to slice and dice this data, and I'll come back to this towards the end of this conversation when we get into resilience. Another way I like to slice this is, if we are going to perform a particular practice, what outcomes should I have my eye on achieving through this practice? How can I use this practice strategically to drive more than just the particular practice itself? The data in terms of looking at enabling the business was pretty compelling. One of the things that popped out right away was the value of modern best-of-breed infrastructure. The importance of having it well integrated. We can see correlated with a number of different enabling the business outcomes. The refresh cycle, which is probably due to just having that mental muscle of reviewing the tech, right? Making sure that the compliance standards still apply, those sort of things, making sure the security requirements are built, those sort of things, tends to drive a lot of different behaviors, as well as strengthens up that peer buy-in, which I mentioned earlier was an area that healthcare providers are a little bit behind on compared to other businesses. Some of these things jumped out at me as being very surprising. Security awareness training is one of them. Correlated with peer buy-in, good. Not correlated with security culture. Very surprising to me, very surprising to me. And why is that? Well, we can't really say from the data, but we can make some assumptions, right? Perhaps it is because when we're doing security awareness training, it is very, very targeted. Perhaps it is when we're doing security awareness training that's not reflective of the culture. You know, think about when you purchase security awareness training off the rack, as it were, and it doesn't quite fit and reflect your culture's perspective and way things are doing. There's something in there, but it is driving peer buy-in. So that tells me that if nothing else, the way security awareness training is done today is at least fostering some of those conversations. Now, when we think about the why of what we're doing for all this, right, it all ties back to maximizing security while minimizing impact on operations, on patient care. And when you think through the operational side of things, some of these findings are even more impactful, especially as we went through the shift to telehealth and virtual medicine. Obviously in 2020, that was a great driver for this, but even into 21 and to 22, we're seeing that, you know, telehealth is very sticky, right? Many of the providers that went telehealth first have remained telehealth through all this. Many of the patients that we're working with now expect telehealth. What do you mean I got to take off time for work to check in? Just give me a web meeting and I'll get on. So these drivers from patient safety and operational concerns translate into some really concerning patterns on the tech front, especially when we think about modern tech infrastructure. So we just go right down the tech stack required for telehealth and virtual medicine. You know, there's a lot of vulnerabilities that are being introduced off of using consumer grade equipment, off of using personal equipment, and this is in the background of the environment we're all interacting with. So when we think about what that tech refresh could mean, when we think about that integrated tech, what that could mean for a security program, we have to think about it through the lens of what are the main tech platforms that are driving healthcare today, and how can we get a refresh cycle in place. You can't really with personal equipment, right? There's a lot of things that need to be thought through on that. How can we get integration in place? That can be really tricky with consumer grade IoT. So there's a lot in this layer that needs to be thought through, especially given the context of that practice rising to the forefront and being such a driver for so many security outcomes. All right, what about managing risk? Well, there's a number of things that pop to the top for managing risk. Again, tech is on the forefront of that, but putting that aside for a minute, looking at secure development approaches rose to the top. So for our organizations that are doing agile development, organizations that are doing traditional development, organizations that are doing DevOps development, right? Building around the EHR, EMR platforms, building new services to go ahead and connect things, to share data out. In those areas, one of the main drivers is secure that development approach, thinking about things like maturing that up and driving it forward. So if you're looking at some areas out of this to focus in on, that could be one to look at, as it's incredibly strongly correlated with having a good security program. IT and security working together, really correlated with avoiding major incidents. I'm going to come back to this one in a bit, but think about it this way. What, as you're building your 2022 roadmaps, what practices, what rituals, what projects do we have that can help bring IT and security together, right? That can help close some of those divides, that can help strengthen that relationship in much the same way that software development has took a huge leap forward by closing the ops and the dev divide. Can we do something similar with IT and IT security? Not sure exactly yet how that will play out, but we're seeing in the data, and I think that raises a lot of questions for me. I love this quote, that the future of work arrives ahead of schedule. It reminds me of the Gibson quote, right? The future is here. It's just not evenly divided yet. When all this went down in 20 and into 21, organizations that were already looking at their platform as a way of being flexible, their platform as a way of addressing risk, their platform as a way of extending services and care, were really well poised to take that shift into remote work, to take that shift into telehealth. One of the examples we oftentimes look at is like Marin General Hospital, which was applying, before all this happened, applying a lot of the what we would now call the zero trust principles, right? Strongly authenticated user, strongly authenticated device, encrypted and protected session, and then a policy that's checking every time we connect to make sure that the user, the device, the context, the conditions meet the minimum requirements for compliance and security. This was driven originally from the compliance program, but by getting that in place ahead of time, they were able to really be forward-looking and handle the shift when the future came ahead of schedule. So I think patterns like that are really compelling when we think about managing risks, when we think about keeping up with the business, and of course, when we think about operating efficiently. Some of the things that popped out of this, in addition to the tech refresh and integrated tech, was the strength of automation. I'm going to come back to that because we drilled deeper in volume 2 in terms of automation and specifically retaining top talent, because that was such a compelling finding. There's so many debates between do you do tech first, or do you do people first? Do you automate, or do you develop your staff? This was very interesting. I'll come back to that. Again, we see IT and security working together, popping up as a big driver for minimizing unplanned work. So there's a couple really good recurring themes that came out of this data set. So that was 2021. Again, 5,000 respondents total, about 300 of them in healthcare, 25 countries pulling this data out. This is a bit of an eye chart, but if you go on to the Cisco website, you can drill into this data and navigate it, and you can pull out certain things you want to achieve. So, for example, back to compliance. We know that compliance is a strength, right? If we start with compliance regulations, let's assume that is a strength. What other types of activities could we be driving with it? Things that we found was that organizations that are correlated with compliant regulations have better executive support reporting, have a more sound security strategy and sufficient staff, have a better understanding of how security enables the healthcare provider, better technology, and are more timely in incident response and disaster recovery, and are better at learning from prior incidents. So if you think about those correlated activities and you think about your compliance program, if those types of outcomes are not coming from that compliance program, well, that's a good time to start thinking about how we might shift and adjust and improve and iterate the compliance program to get those. The opposite of that is, and this is a question I always wonder, is are we spending our time in the right place, or should we stop doing things, right? What should we start doing? Yes, but also what should we stop doing, because there's only a finite amount of time in the day. So some things that were not correlated are also interesting. One of them was asset inventory. That really surprised me, because we spend so much time on configuration management and so much time on those types of topics. Identifying top risks and accurate threat detection, not correlated. I suppose that makes sense from a compliance perspective. You're trying to put in place practices that address all the risks, right? And it oftentimes isn't real-time threat driven. So I guess that one makes sense. Metrics surprised me. As a person who loves metrics, what do you mean the reports and the charts that I'm generating are not driving compliance regulations? And then automation. Again, I'm going to come back to automation in a bit. And finally, security awareness training and role-specific training. That all just surprised me so much, right? When we start looking at what does good look like, we can have a better idea of where we need to act and what that action will produce and what the outcomes might be. But we also can have a better outcome or idea of what maybe we shouldn't do. Maybe we should, deprioritize security awareness and training. It's a little bit heretical to say, right? So much of what we talk about is better training, better awareness training. But if it's not driving the outcomes, or conversely, maybe we need to think through how we're delivering that security awareness training, and maybe we need to improve it and tightly tie it to the compliance and tightly tie it to security culture. Either way, if we minimize it, that gives us a whole line of opportunities. If we maximize it, now we know what we need to measure and look for. And combined, this really was a very compelling set of data to help me figure out what I need to do. So at the end of the day, there were significantly correlated practices, 5 of them, 2 of which I would say are directly tied to resilience, which I'm going to get into. And this generated a ton of questions, like some of the ones I've posed to date. And that led into the work that we did in Security Outcomes Study Volume 2, which was done this year, which was all around maximizing those top 5, right? What we started calling the Fab 5. How do we take the Fab 5 and make them better? How do we tease out what's working and what's not? And how many of them are even important? One of the things that was really interesting to me out of this data is that the top 20% security programs are performing strongly in all 5 of those. And the bottom 20% are not doing any of those strongly. So we can start to figure out where we're at. What would happen if we just did 2 of them well, 3 of them well, 4 of them well? 2 of them I want to pull out, because I mentioned them in terms of resilience, is threat detection, incident response, and DR. There's been a long debate. Do you need people, process, or technology? And we've got out of volume 2 a better set of this. Now, I will say that volume 2 has not yet been sliced by healthcare. So this is across all industries, but you can see a really good line of the importance of people over process, the importance of process over technology, with the strongest providers, 3.5 times performance boost over other programs, combining all 3. Threat intel is always important, although there's a really interesting U-shape here where people who are not using it think they're doing great, almost as good as people who are using it extensively, which may mean that without good threat intel, we're just not aware of the threats. Another interesting thing that came out of this data was what happens when you outsource these capabilities. And people who did them internally, pretty happy. People who did them externally, pretty happy. The middle is where there's a lot of struggle. If you think back to the disconnect between IT and IT security, if you think back to the time pressures in our healthcare environments, specifically for security, I'm wondering if this isn't reflective of shared services, right? If you don't have good shared services model, if you don't have good collaboration cadence, if you don't have a good RASI and all those sort of things, it can be really easy for these things to go off the track. Is it better to automate? I mentioned the automation popped up. We oftentimes try to position automation as a solution for the talent shortage, which is a whole other debate as to whether or not there is a talent shortage, or as a replacement for being unable to get good talent in. But I think the data shows it's much better to start with good talent and supplement them, make good people great through automation, as opposed to just trying to do it with tech alone. On the disaster recovery side, how much should we cover, right? There's always been a focus on system and scope of just your top 10% or just your top 20%, just EMR, EHR, just what's needed for patient healthcare and safety. There was a significant boost in the ability to recover for organizations who said they were covering 80% or more, which is compelling, right? Because most of the BCTR recommendations is right here. So we can see that right away there's some major gaps between what people are doing and what people are teaching. Organizations with resilience are more likely to have executive leadership support, because we're talking about what technology and what risks mean in the context of patient engagement, patient outcomes. More likely to get that peer support and buy-in, because we know what these components mean, and therefore we can have a better conversation when we're trying to apply controls or whatnot. More likely to be running cost effectively. So a lot of downstream benefits from this, otherwise dowdy, right? Continuity and recovery is kind of like this dowdy middle child of the security capability. We don't necessarily pay a lot of attention to it, but it's surprising in terms of what it drives. And some of these things, again, it's driving our things that we know from the data healthcare organizations struggle in comparison to their peers. To get good continuity and recovery, you have to practice. I love this slide because I've been saying for years, we need to practice. Figure out what your plan is and practice it. If you don't practice it, it's gone, right? If you're not driving every day, your ability to be a good driver greatly reduced. Similar with continuity and recovery. It doesn't have to be every day, but the data shows that 5 times a month, 5 disaster recovery activities done a month, right? Different ways of practicing are correlated with the strongest outcomes. And then we can start to look at some really interesting things like embracing chaos engineering. I think this is a little bit leading edge, which is probably why people who are using it are way over here in terms of efficacy. But we can start to think about different ways to do those practice drills. From a resilience in healthcare perspective, and that systems and scope, I think one of the main messages I like to get through in this talk is, if you're looking at all the different ways that we're delivering services now, from remote to in the workplace, telehealth to the clinical environments, we need to scope those areas out, figure out how we can cover 80% or more of them, figure out how we can do exercises within that space in order to drive resiliency. So some final thoughts. We're still exploring this data. There's a lot of open questions. As a matter of fact, I'm working on a subset right now just looking at the zero trust components of these things. So please do watch this space. But I believe that this data is crucial to the future of our healthcare InfoSec programs. So figuring out what's working and doubling down on it, and figuring out what's not and improving it. With that, thank you very much. I appreciate the time today. Oh, and do we have any questions?
Yes, thank you, Wolf. That was excellent. We do have time just for a couple of questions. The first being, in your conversations, what priorities are you seeing from healthcare security leaders in conversations with them in terms of what they're looking at as top projects for 2022?
So a lot of the initiatives are addressing the work that we did in 20 and 21 to modernize the infrastructure, to put controls in place for people coming in remote. Again, that gets to some of those zero trust conversations, to put in network segmentation and to iterate on the trust boundaries and the controls within the clinical environments. So that would be a very broad theme. We did a lot to be responsive, and now we need to rationalize and improve and iterate those infrastructures.
And I think this may be something that a lot of folks can relate to. If we don't have time to test 5 times per month, what are the most important of those multiple tests to prioritize?
Yeah, so this gets back to one of the most impactful behaviors is bringing IT and IT security together. So when we think about those 5 things, it can be tabletops, they can be walkthroughs, they can be full pull exercises. Many of us don't have time to do all 5. So look for ways that you can do tabletops or walkthroughs that bring IT and IT security together, so you can build that strength up. look for ways that you can do one or two that reaches out to the clinical environments and brings those folks in, so that you can make sure that we're also doing a really good touch point with the technology to the physicians and staff that are doing the day-to-day activities, to make sure that we're addressing the right things. I think even if you do one or two and start down that path, you can strengthen up those patterns of behavior and strengthen those relationships.
Excellent. And it looks like we are out of time. So thank you to Wolf for this excellent presentation, to our audience for joining us. We hope that you check out the additional resources that we have, and have a great day.
All right, excellent presentation. Thank you so much to Wolfgang and the Duo team. Really insightful stuff there in the report that Wolfgang shared and walked us through. So I appreciate that. I learned a lot. I hope that you did as well. I've just brought up the poll question for everyone out there that says, what additional information would you like about the Duo security solution? And I'll leave this up and give everyone a moment to respond. While you do that, or after you do that, I also want to encourage you to check out the Duo Security handout. It's there in your audience console. The handout is entitled Securing Remote Access, the Essential Guide, How to Build Trust in a Modern Remote World. I'm sure that this is something that a lot of healthcare organizations are dealing with. So make sure that you check out that very well done guide there in the handouts tab. All right, thank you to everyone who responded to the poll. We do appreciate your feedback. Right, and with that, it's now time to bring in our next presenter on today's EcoCast. I'm excited to welcome John Capello, Vice President for Strategy and Field CTO at Nasuni. Hey, John, it's great to have you on.
Hey, thank you. Really appreciate the opportunity here. Thank you.
Absolutely. Take it away.
Thanks. And I appreciate you all sticking around and listening to what we have to say about sort of a different perspective on how to think about the way in which healthcare IT is transforming. And Nasuni, we really look at the world from the foundation of a file services platform, from the fact that it's files that run your business, it's managing files, protecting files, moving files, analyzing files, which actually drives value in the business. And at Nasuni, that has been our mission. We've reimagined file storage infrastructure really from the ground up and built a platform based on cloud technologies. And when I say we've based on cloud technologies, it's things like what are called object stores, S3 for Amazon, or blob storage inside of Azure. It's the ability to do serverless infrastructures in the cloud, so that compute can happen in a scalable and more effective and efficient environment. And so we've built this cloud infrastructure around those technologies so that we make it easy for you to consolidate your storage and deliver this unmatched level of simplicity, cost savings, and really data recovery. And I'm very excited to talk about some of those. But to think about Nasuni, we're a little bit over a 10-year-old company. We've been around for quite a while, at least from the beginning of the what's now the cloud era. And we've been helping companies in healthcare, pharma, biotech move their workloads to the cloud. And it really covers everything from payer providers to hospitals, some of the providers that have to deal with very, very large files, something like Austin Radiological Associates, which has been a customer of ours for going on, I think, 7-8 years now. Hologic, which is doing some very interesting cutting-edge stuff in terms of cytology. Anywhere where there are challenges with managing large workloads of files, challenges with either the capacity that you're dealing with inside of your data center and you're trying to move to the cloud, or you're trying to put those files in front of even more powerful compute environments that the cloud has to offer. So that's what we've designed our company around. It's to solve a problem like this. The problem of how do I manage file storage? How do I manage durability of my file infrastructure? How do I manage moving files from one place to another? The fact is that the industry that you grew up in, the industry that you've the file storage industry that you have been accustomed to has been one which is very data center focused, and it has divided out the different functions of what you need to do to protect and store and move files around. You have separate backup systems from separate primary storage. You have files that are specifically for file sharing. And ransomware and disaster recovery business continuity has actually been sort of a secondary or orthogonal challenge to the file platform. It hasn't been something that's been built into the platform itself, or I should say traditional platforms. And so this here is tough to manage. It's tough to tough to develop on top of it. It's tough to extend it, but it's very tough to manage, and it also ends up becoming pretty costly. So we took a very fresh approach with file storage because we said to ourselves, well, what would it be like if you had file storage that started with things like AWS S3 as the foundation of your storage platform. And when I mean a foundation for it, I mean, we decided that we were going to create a file infrastructure that started with a file system, and a file system that lives inside of S3. In other words, if all of the infrastructure around the SUNY or around the Nasuni system that you deploy would go away, and you just had your S3 bucket of Nasuni left, that would have everything that you need to know about your file system. It would have all your data, your metadata, and infinite versions of your file system. So first and foremost, we said you need to start with a file system that can be stored completely inside of an object store. So the file system is only defined by objects. There's no other technology you need to define that. But then to access that file system, that's where you need something like an edge appliance. The edge appliance is what takes those objects from the file system and turns them into basically a little NAS device that looks just like a traditional NAS. It sort of mounts shares, it mounts exports. It looks like a replacement for your ISON or for your NetApp or for your Windows file server. But what's really behind it is this infinitely scalable file system. So if I have a file system that can grow to, let's say, petabytes of data or billions of files, or it can handle very, very large files, I might not need all of that in the location where I need to access those files. You know, that might be a 400 terabyte volume, but I really only need, say, a couple hundred gigs of, say, DICOM images. If I've got a remote office where I've got some radiology equipment. So we allow those appliances to only put the data and metadata that they need for that given workload. So the Nasuni solution, it has our proprietary file system inside of S3. It's got these appliances on the edge. But then through that, we're able to do all of these other interesting things. We can manage it from one single pane of glass. I'll get into a little bit later. We can also use some cloud services that we've created to be able to share files between different locations. But the really important thing is that file system is very, very large. You don't have to worry about the limits of number of files or number of directories. You can keep on adding to it. But most importantly, it can be versioned. And when I say it's versioned, it's not as if you can version that every week or every month. You version your file system every few minutes. Every few minutes that you're moving data into the object store, you're creating a new version that you can restore back to. And the very unique thing about this, about our file system, is that you have versions of the entire volume that are available to you. You also have versions of every folder and every change that happens to a folder. And you have versions of every file that happens as well. Well, with this level of granularity, you have lots and lots of different restore points. And what that means is you actually have what we see as really the best-in-class ransomware recovery system. Not because it's something that we've added to our system, but it's a consequence of how we've designed our system. So we created this versioned file system. It has a ton of different restore points, which means that no matter how large of an attack I experience, I could have 5 files being attacked. I could have 100 files attacked. I could have 1 million files attacked. I could have literally a petabyte of data attacked and a million plus files. To restore back to a point where everything was safe before the attack is really about changing back to that one pointer to that one restore point, which again happens. You can pick any different level throughout the file system and any different point in time. So what this graph really shows you is that if you think about how long it takes to restore based on the number of files that you have, what you would expect is that if I have more files to restore, it should take longer for me to restore them and back them up. And that's true for traditional backup. Can be obviously very, very painful. This is why, ransomware over the last few years has really been such a threat. There's some new technologies, which we'll call kind of like cloud backup technologies, which do a better job, but they're still trying to move data from one location to another location. We have a very different approach. What we do is we only have to worry about moving the pointer of the current file system to the most recent version of the good part of the file system. And when we restore that, that takes literally about a minute. And then every time someone comes to your appliance and tries to access files, they're going to be told, hey, look, here's a new pointer to a new part of the file system, and that will then point to other pointers in the file system and other pointers to then provide the fully hydrated, the fully good copy of the file system. It's an immutable file system, so once you write things into the object store, we never change that. That's why the versioning can work so well. But this is a really, really important point. No Nasuni customer has ever had to pay the ransom. And that's because they know how to restore very, very quickly so that ransomware, an attack of whatever scale, really becomes a nuisance. It does not become a threat to business continuity. It's all because of the nature of the file system. And so just to talk and to kind of recap a couple of these things, at the center of the infrastructure is this thing called UniFS. It's our proprietary file system. The gold copy of all your files lives up there. So all the DICOM images live up there. All the healthcare data lives up there. The durability of that comes from the fact that we have immutable copies. So let's say that I'm going to take let's say a set of research data that's getting updated. It's log data that is constantly being appended. So there's a version of the research data that starts out and it's, let's say it's a 20 meg file. Well, when that 20 meg file gets written to an edge appliance, what we do is we are going to break that file up into smaller chunks. So let's say we're going to use 5 meg chunks. So you're going to have 4 different megs to that, 4 different chunks, 4 different objects. When we commit that into S3, the edge appliance creates those 4 objects, but it also creates a small little object, that manifest file that I was talking about, that says, hey, log number 1.txt equals chunks A, B, C, and D. Now, if I go back and I'm making some modifications on those log files, let's say I'm going back to highlight some parts of the file or I'm putting some annotations into the file. And it turns out the only thing I really change in that file is the last chunk. So chunks A, B, and C are all the same, but chunk D is different. I don't create like a D prime. What I do is I'm going to create a new chunk called chunk E. And then I will create a small little manifest file that says, hey, log.txt version 2 are chunks A, B, C, and E. And that's what's going to get put into the object store. So there's never any there's no part of the code path at all. There's never any condition under which we would overwrite any of those objects. They're all immutable. And of course, as you know, that's really, really important when it comes to HIPAA compliance or when it comes to ensuring that you have the exact version of what was committed. We don't do that as an option to how you would want to store data. We do it as a design feature of our file system. It is all worm, write once, read many. And like I said, because you can do all these different versions, it becomes really a pretty different way of thinking about your version history. We have customers that have been with us for 7 years. A very large healthcare customer of ours that has 300 terabytes in a volume, and they have close to 500 million different restore points. because they're constantly putting data into the system, and we are constantly adding those little reference files along with it. And so what you get here is really a system where you don't have to think about some of the limits. You don't have to think about the limits of capacity or file size, files per volume, snapshots per volume, the total volume size, the number of locations, and I'll talk about that in a little bit, but the number of locations is a very different proposition when it comes to Nasumi, because that same file system can exist in lots of different locations. But how I get to my file system are these edge appliances. And those edge appliances have been designed so that they have just the cache that you need, just the information that you need on the edge to be able to access the data for the workload. So again, if I have DICOM images at the end because I'm either doing research or I'm attaching it to one of my PAC systems, that allows me to right-size that appliance just for the data that needs to be made available. We've got customers that will set up programs where they will fault in just the data that's coming on premise, or the data for the customers that are going to be in the offices for that day, and the cache is designed just to be able to fit exactly what they need. And because we have this intelligent cache based on how recently you've used things, we will automatically evict things from the cache when they age out. What's really impressive is we have seen across the board about a 98% hit rate on these caches. So you're not waiting there for data to be populated from the object store from S3. But you don't have to over-provision that cache. You usually find, depending on the workload, somewhere between 1 and 9% of the active data volume is what you need for the size of the cache. And I'll just talk about a couple other things. What's also really important is the fact that you can manage this all from one location, from one single pane of glass. We have an appliance that you deploy. It's called your management console. It is also available through a REST API or can be controlled through a REST API. That allows you to manage your logical and your physical environment. I can spin up appliances here. I can spin them down. I can create volumes from here. I can attach volumes to different locations. It is the way in which we can enable a large environment to be managed by a very, very small team. So we've had customers who have come to us because their file system or their file infrastructure is growing at 30 to 40% per year, but they know that they can't grow the team at that same rate. And so this one single pane of glass, this one API-based management tier allows them to manage all that. And then finally, I'll talk about two quick things. One is our orchestration center. This is what allows for different appliances that are sharing the same volume to be able to synchronize between one another. And it does it in two ways. One is it will coordinate when changes are made and when they're being put into the shared bucket in the cloud, but it also offers the service called the Global File Lock. And Global File Lock is a massive service that we have deployed in 6 different regions around the globe, all through AWS. It's one of the very few multi-regional active-active failover systems. We can brag about our 99.999% uptime over the last year in all 6 of those regions. And it allows you to be able to open a file in one location and then have someone else have that lock that is created on that file, that local lock, being respected by any other appliance that could host that file. We also offer this service called the Analytics Connector, which allows you to take any part of your file system and send that into a pipeline to be analyzed by any of the wonderful services on AWS, whether it's Kendra, image recognition, Textract. The Analytics Connector says, take my file system, take that incredibly large volume, and now I want to extract just what I need. Maybe it's just the PDF files, maybe it's just the images, maybe it's just the DICOM images from the last 2 weeks. Take those and make them available to any of the services that exist inside of AWS. Just very quickly, one of our customers who's we're very proud to have been with us for years now has been Johns Hopkins. And one thing that they've definitely pushed us on has been how can we help them automate and simplify the management of their environment. So through our API and through our, with the NMC, through the scripts that we've developed, we've made it easier for them to be able to provide services to their end users effectively. And then finally, when you think about Nasumi and you think about the sample deployments in Nasumi, think about the fact that these edge appliances, which we don't charge for, by the way, you can actually deploy them as many as you want. really gives you the flexibility. So when thinking about the next version of your infrastructure over the next year, the next 2 years, you may have questions about what's going to be on-premise, what's going to be in the cloud, what's going to be in a local region, what's going to be in a cloud region. You may not know which is the best place for an application to run. That's okay, because with Nasuni, you make a decision about where you want to create your volume, but then you can put that data anywhere you want. You can spin up an appliance within a couple of minutes. So if you wanted to try out the new GPUs that are available in one region, you could put your data there just by deploying a Nasuni Edge appliance and having that data available through a volume that becomes enabled there through the NMC, or put it on-prem, or work in any kind of like hybrid workflow between the two. So I know we're just at our 20 minutes now, and I want to thank everyone for listening, but I have time for any questions. There are questions out there.
Absolutely, yeah. We do have some questions for you. Before we get started, I'm just going to bring up this poll question, John. This one's for everyone out there in the audience that says, what additional information would you like about Nasuni? We want to get your feedback here on this poll. Some great questions coming in as well. And so if you have a question about the Nasuni solution, now's the time to ask. First question here comes from Bradford, who wants to know about snapshots with Nasuni. Mm-hmm. Can they be configured at set intervals, hourly, daily, weekly, monthly, with different retention policies, if that's possible?
That is, and that's a great question. So we actually have the ability to set them per volume and per appliance. So you could say that I want to set a snapshot, which could be as low as a minute actually, or as long as I think 6 hours might be our sort of maximum. You can also set different times of the day when you want them to be active. That's so that you can be assured of having points at which you're going to be pushing data into the cloud. In terms of retention policies, yeah, you could set up retention policies for weeks. You could set up retention policies based on the total number of versions that you have. But all those are available as well in the system, so you don't have to keep everything around. The one thing I'll say about the snapshots is that we've heard from customers, especially the ones that are trying to share between different locations, how much they appreciate the fact that when you snap to the cloud, it's also the way in which you propagate that data to other locations. So we very recently deployed a new innovative solution we call the Global File Accelerator. And what that does is it looks at the activity on an appliance. And based on some intelligence that applies to what it sees in the activity on the appliance, it will determine which appliances have data that is most collaborative. In other words, if I'm creating data that exists in a directory that's being accessed on other appliances as well. So there's this intelligent system called the Global File Accelerator that will supersede any of the snapshots, and it will say, I'm going to look for the most collaborative data. I'm going to push that to the cloud, which also happens to mean I'm looking at the data that most people are working on together. I actually provided more restore points for ransomware protection too. Those two things kind of happen at the same time. As when I snap to the cloud, I'm not just making it available for others to access it. I'm making it available so I can restore to it as well. So you can definitely put that out there. You can definitely put your own snapshot schedules out there. But we do have some interesting, cool, like intelligence that we kind of apply to it.
Nice. I like that flexibility there. Let's see, another good question. They're asking, can Nasuni mirror the entire data set to a secondary cloud object store and then do a failover automatically if possible?
Yes, and almost. We can mirror to a second object store. We've done that. There are a couple of different ways in which you can do that. We have some partners that we work with so that they allow for that secondary copy to be written. Depending on the technology you're using to do that mirroring, or the ones that we support to do that mirroring, depends on the rate at which we can do the failover. And we have on the roadmap, one of those integrations will be one in which we can do an automatic failover. The challenge with those kind of asynchronous backups to the secondary copies is you have to always be tracking the point in time when both are absolutely consistent. And it's from that we can then do the what we basically kind of say like rebasing the system to work off of the other object store. But that kind of disaster recovery is just what I call like the nuclear option. That's what happens if the entire data center goes down. The disaster recovery we see all the time is where an appliance will be offline or an appliance will go down. And maybe that's like one part of a data center. Those things can fail over within seconds, and we have a number of different models at which you can actually do that and set it up to be automated failover.
Excellent. Very cool. Let's see. Another question here. They want to know, is Nasuni FIPS 140-2 certified?
So Nasuni Nasuni by itself is not. So our stack is not. So we're not FedRAMP certified. We're not FIPS 140-2. However, we have it in the pipeline to do 140. I think it's 140-3 actually. Over the next year, there are different things about the FIPS certification that we do have in place. Particularly if you are buying an appliance from us, you can have self-encrypted drives. But by virtue of the fact that it's a virtual appliance, there are many of the FIPS, many of sort of the FIPS protections or the FIPS standards that happen within the virtual environment. That doesn't say that Nasuni itself is FIPS certified, but putting it inside of a virtual environment that is does certainly cover some of the bases on that.
Excellent. And then what about, can you go a little bit deeper into what ransomware recovery would look like with Nasuni?
Sure. Yeah. So it's interesting because the way in which you recover from ransomware is based on the same way in which you would recover if a file was accidentally deleted. So the same system that recovers from the massive attack is the one that recovers from the very tiny one. And inside of the Nasuni Management Console is a file browser. And what that file browser has is the ability to look at the file system that is live on any appliance. So I can first choose the volume that I'm looking at, then I choose the appliance I'm looking at, and then I'm browsing through a file system. And I now have a selector that's, now I can browse the file system, but I can also then bring up a calendar. And depending on where I am in that file system, that calendar will show me how many different versions are available on that day. So I can scroll, I could be in one section of the tree, I open up the calendar and I find different dates in the calendar. And within each of those dates are different links to different times. And if I click on any of those links, I will be shown what is the state of the file system from that point in time. And then there's a little link at the bottom that just says restore this. And you restore it, you have a couple of options about the way in which you would restore it, but it's really, really that simple. It's, again, it can happen at any level. It can be the file itself, it can be the folder itself, or it can be the entire top level, it can be the volume. But you're really selecting the volume, the location, and then the point in time. And once you can kind of navigate all that, that's where the restore happens.
Got it. Okay. Thank you for clarifying that. So another question, how does Nasuni deal with the problem of detecting personally identifiable information?
Okay, or personal health information. We can integrate with a number of really the cutting edge services around this. So Amazon in particular has something called Amazon Macy, which has a way of pattern matching to all of the very typical ways in which you would see personally identifiable information. And with our analytics connector, you can say, I want to look at one part of my file system. Actually, you can say one part of my file system for whatever versions I want. Let's say I want to look at the HR folder for the last. Actually, HR probably had one for personally identifiable, but let's say the public documentation of our folder for the last 5 years. I want to make sure nothing is in there that was identifiable. I could use the analytics connector to grab all of the different data that fits that description. Let's say I only want to look at PDF files. It will take only that data, and then it will put it into a pipeline in which Macy can analyze it. And so what we've tried to do is make it very easy for you to use the best-in-class systems that AWS has to offer and point them to or integrate them with whatever part of your file system that you want to analyze. So you don't have to do an all-in-one solution. You don't have to be constrained by the current data set that you're looking at. It can be any part of the file system, any range of time that's available to you or that you want to look at. And the analytics connector is this, it's a suite of tools that you run inside of your AWS environment, and it will make that movement happen for you.
Very cool. Very cool. I like that. Innovative. Another one here. How does Nasuni work with DICOM files?
So one of the real big benefits of Nasuni is that we are very efficient about how we use our files or how we store files, because we can chunk those files. And by chunking the files, you can optimize for the size in which you can get the highest throughput into the object store, into S3. So with DICOM files, it's a perfect example. We do compress files that, DICOM files don't really do, but we do get a little bit of compression on them. And then we have these optimal chunks so you can move them up to the cloud faster than pretty much any sort of standard way of moving file data. We have a multi-threaded approach, so once we chunk all the data, we can launch many threads to move them as quickly as possible. And then we can fault just the files that we need. So if you have multiple DICOM images in a directory, but you really only need to access a few of them, we won't fault in all the files. So for very large files in general, like DICOM, we're very well suited to move them from where you might be accessing them to ultimately where they're going to be stored up in the cloud.
Very cool. I like it. All right. Well, John,
I'm
afraid that's all the time we have here in our live Q&A session. There's a number more technical questions there for you in the queue that we'll be routing over to you. A really great presentation. Thank you so much for being on the EcoCast.
I appreciate it. Thank you guys so much.
And for more information on Nasuni, I encourage everyone to check out the Handouts tab there. You can download a solution brief from Nasuni on how to store unstructured healthcare file data in the cloud cost-effectively and securely. All right. If you haven't answered the poll question, now is the time to do it. I'll leave that up while I announce our final Amazon $500 gift card winner. This is going to Stephen Lucier from Pennsylvania. Congratulations, Stephen Lucier from Pennsylvania. I will post all the prize winners' names in the questions pane. All right, those are posted. Before you go, I do want to remind you to visit ransomware.org for everything you need to know about ransomware. It is the definitive ransomware resource. In fact, you can click on ransomware.org right there in the slides window, and that will take you to the ransomware.org website for more information. I know that is a hot topic that so many of us are dealing with on a daily basis. So make sure you visit ransomware.org for information on how to understand, prevent, and recover from ransomware. Also, don't forget about the Gorilla Guide Book Club. You can download free educational IT books there in the Handouts tab of your audience console by clicking on gorilla.guide or Gorilla Guide Book Club. That'll bring you to the gorilla.guide website. And then if you are a potential sponsor of an upcoming MegaCast or EcoCast event, reach out to us at connect@actualtechmedia.com to chat with us about presenting. And then finally, I hope to see you on next week's big event. This is our Enterprise IT Virtual Summit, one of our biggest events throughout the whole year. Happening next week, it's the IT Innovators Day, analyzing the next wave of tools, products, and services happening next Wednesday. Thank you to everyone who joined us today on the EcoCast. I hope that you learned a lot, and I hope that you have a great day. We'll see you next time. Bye-bye.